अरे ये अच्छा नहीं है, अरे ये क्या हो गया, you know, कितनों की सुनोगे आप.
Exactly. Do celebrities age better?
Nobody has perfect skin. There is no such thing as perfect skin. I want the patient to talk. I want to listen to what he or she wants.
And do
They
you
are.
feel the pressure to look good all the time?
Well, I'm a big believer of not taking supplements if you don't require it.
Are we trying to demonize a natural process? Let's first start with the word anti-aging. Is it a misnomer? Is aging more accepted in men as compared to women?
Any day, whatever rules and guidelines that are given, because every face is unique.
Yes. What would be the right age to start skincare from an anti-aging perspective?
I think slowly Instagram is also becoming very vindictive. In today's day and age, especially the youngsters are constantly getting influenced.
What are your thoughts on face yoga? 3 things that you want people to take away from this podcast. Hi everyone, today we have Dr. Jaishree Sharad on our podcast. She is a renowned cosmetic dermatologist practicing for over 20 years in Mumbai. She has shared her vast knowledge about different anti-aging procedures. So this podcast is information dense. You will get to learn everything you need to know about anti-aging treatments as well as lifestyle changes to slow aging. I'm sure you love it. Welcome, ma'am, to the podcast Decoding Health. So, because you have been like a pioneer of anti-aging and introducing all these treatments in India, I wanted to do a podcast with you regarding this. So, we'll just discuss all aspects of aging, how we can slow it, what are the treatments that actually work and what don't. So, let's first start with the word anti-aging. Is it a misnomer?
Completely. What is anti-aging? First of all, you cannot turn back the clock, right? I think it should be healthy aging or pro-aging or some sort of a term where you can put a break probably and slow down the process of aging. And rather than say anti-aging, I completely think
exactly,
it's a
ma'am.
misnomer.
There's nothing that we can do to turn back time. There's nothing we can do to completely reverse it.
Yeah.
The best we can do to slow it. But I guess because this term has picked up so much, it has become a part of our vocabulary also, like anti-aging. Any kind of product is anti-aging. Procedure is anti-aging.
Everything's anti-aging.
But it is all...
I think it should be healthy aging.
Healthy aging, slow aging, embracing aging.
We should all change it to pro-aging, I think.
So do you feel that all these products and treatments that we talk about with our patients, are we trying to demonize a natural process?
No, I wouldn't call it demonize because that is like, too harsh a term. Just like you have so many other fields, like for example, dental work, there's cosmetic dentistry, or somebody who has now access to Pilates or all the different forms of exercise to sort of sculpt their body and also be fit. We have ways to, I would say, age gracefully but youthfully, right? So why not? And why, I don't think we're demonizing it, but some sectors, of course, are now, bombarding people, and people are getting overwhelmed with this whole term of anti-aging. And I would want to look like somebody else, or I would want to remain young. Oh, wow, she is 60 and she looks like 40.
Yeah.
The whole Instagram thing, social media thing. I think that's a bit much, So the whole idea of looking the best version of yourself, but looking youthful and fresh.
Yeah, exactly.
Is what we should promote instead of, not demonizing. I think it's more like, that's a little harsh a word.
I feel it is just extending towards how we
Self-love.
say improving. Yes, improving self-care, improving longevity.
Yeah.
So just to make you feel better, maybe make you look as good as you feel. Yeah. I get a lot of patients, they feel that I feel 30 inside. Whenever I look at the mirror, then I realize, now I'm 50.
Correct.
That does happen. When you age, sometimes you feel that how you feel inside is not reflected on how you look. So we are just trying to
help you out with that. So that when you wake up in the morning and you look
feel good
in the into the mirror, you just feel so happy and confident that, wow, I am this person,
Yeah,
I
just
think that's what we dermatologists should be aiming to do.
yeah, just instilling the confidence and making them not fear aging, but just make the whole process smooth and to help them look their best. That's all. So, ma'am, I just wanted to discuss about how does the face age. When we talk about aging, people only think about wrinkles and sagging. That's the only thing that is. So, I just want everybody to understand how the face ages, what are the changes that occur in different layers.
Yeah.
Then they'll be able to understand why we do certain treatments that we do.
This is a very pertinent question because a lot of times patients come and say, we're using the most expensive creams, and, we're very, very particular about our diet, and, yet the face is really sagging. Now, when you talk of the face, it's not just the skin, because we have first the bone, right? And then, I'm not teaching you, all of this, but this is for our audience,
Yes.
that you have bone, and then you have a thick layer of fat over it, which is the deep fat. And then you have a muscle over it, and that helps with all our movements. And over the muscle, there's again a fat layer, and then there is skin. So there are so many layers, and in different parts of the face, in fact, there are more layers. Like in this temple area, a small area like this, you have 10 layers. Here, the upper face, you have 7 layers. But by and large, it is these 5 layers, and all of them will go through the process of aging. It's not just skin. Skin, yes, there's collagen, there's elastin, which is actually the framework. It's forming that full framework for our skin to stay stable and elastic. But if the rest of it, if that sort of is not in place, then everything falls. The support is not there. So as we age, what happens? The bone starts to shrink. There's resorption. It starts to, imagine it's breaking down. It's a building and the bricks are sort of collapsing. That's the bone. Then you have the deep fat that starts to disappear slowly. Whether you are very healthy or not, the deep fat still starts to resorb. It starts to disappear. The muscle starts to get thin. And then there are certain ligaments which are there, which are connecting the bone to the skin surface or the muscle surface. Those become a little loose. Okay, so imagine over that what happens. Then there is that little fat and that skin. The skin is also becoming wobbly because with age, the collagen is degenerating. The elastin fibers are degrading. So the skin is becoming wobbly. And therefore, the support starts to go down. It's like a building which is slowly crumbling. And as a result of which, everything starts to look as if it's descending downwards. So the process of aging is very intricate. And there are 2 parts. There's intrinsic aging, which is, the whole normal process of aging that our body goes through as we age. Part of it is also genetic. But there's also extrinsic aging, right? Which is due to your lifestyle, sun exposure. When I say lifestyle, it is what you eat. Are you abusing yourself by smoking a lot or drinking a lot of alcohol or even having a lot of sugar, stressing a lot? What a major impact it has on our skin and hair, right? Not just the body. Are you sleeping well? Are you sleeping on time? I have this thing on my finger ring. And trust me, I'm not looking at steps and all of that because I know that when it comes to exercise, I'm doing my bit, I'm eating healthy, but I don't know if I'm sleeping right.
Yeah.
And I want to monitor that. And now, and whether I'm calm or not throughout the day, because you know how it is in the clinics, right? So it keeps spiking. And then yesterday at 2:30, there was a spike and very, very stressed. And I'm trying to think what happened and I could identify it. So stress plays a major role. Sun exposure, pollution, of course. People who are living in cities like Mumbai and Delhi, I don't know what's going to happen, but it plays a big role. Recently, there was this person who came, all of us know, he came from the US and he left a podcast
midway.
and he went away saying, look at the pollution level here because that also degrades the collagen. So all these factors together will hasten or speeden up the process of aging, not just of the entire body, but the skin, the muscle, the bone, the fat, everything.
Yes, ma'am.
You know?
That's what I wanted to stress. And I wanted you to reiterate this, which you explained so beautifully. Because people only look at aging at the skin level. And they feel that as long as they're doing a skincare or, applying some serums and a sunscreen, that's enough. But it's not. And the other things that comes with the lifestyle is so important, the diet is so important. Along with that, there are certain changes that we cannot help. We cannot
The hormonal changes.
Yeah, the hormonal
also,
changes.
for example,
in the structural changes, like you said, the muscle, the bone, the fat, how they reposition, that cannot be changed completely. So that is also a part of aging, which we try to overlook, and that is when all these devices come into being, which we will talk further, and how we have to address all the layers, not just the skin.
I want to tell you here that when you apply a cream, it does not necessarily reach the layer that it is even supposed to reach. So if it's not even going to the deepest part of the skin, how is it going to affect your, layers below the skin? Which is why people should understand that you may use the most expensive or the best cream, the best. We always get this question, best sunscreen, best moisturizer, best. You use all of that, but if your lifestyle is not good, if you're stressed, if you're not happy, and if you're exposed to a lot of sunlight, a lot of pollution, it's going to crumble.
Yes. Correct. So we have to approach aging holistically. Extrinsic and intrinsic, both are important, and we need to understand that. And ma'am, how do men and women age differently? Like structurally, we can just discuss how the aging is different in men and women.
There was a study, there were a couple of studies done, anthropometric studies, where they studied the skull. And, we also know when we look at a man and a woman that the skull is generally a little larger in men than in women. They have, their structure is such that they have more robust features. Their collagen is very thick and dense as compared to females. They have more oil glands, sebaceous glands. So they produce more oil. And their fibroblasts, these are cells which produce collagen, they are more dense as compared to a woman. Apart from that, they have testosterone, right? They have good testosterone levels as compared to women. Women have more estrogen. So estrogen tends to dry the skin more. If it is dipping, the skin dries, and which happens as we age. Therefore, when a man ages as compared to a woman, his structural aging is much slower because his collagen is denser, his fibroblasts are denser. So it's not only slower, it's also lesser than the woman counterpart, Yes. And so that's, I think, one of the major things. Also because of their...
And also the presence of facial hair, kind
yes,
of camouflage.
So I was coming to this. Yeah. Yes. So when I said, they have more oil glands, so there's constant production of oil and, less of that dry, parched thing, skin. And as you rightly said, more hairy, right? I don't know if you've ever realized this, even, I'll tell women, when you do your threading, you'll see that part of the hair which has been removed shouldn't be used the word fair. I shouldn't be using fair.
Smoother,
but it's smoother and it's lighter than the rest of the skin because your hair were protecting that skin. And imagine for men, like if, they're more hairy all over, and if they have beard, they have a natural sunblock there.
Yeah.
Right? So the process of aging in terms of texture, pigmentation, structure, everything is slower as compared to a woman.
Yeah. Also, is aging more accepted in men as compared to women?
Any day. I mean, look at it. Everybody will love a Richard Gere and say, look at him. It's like, salt and pepper hair. Imagine a woman with salt and pepper hair. It's not accepted. Why doesn't she color her hair? Is the first thing that comes, right? Men are allowed to have a lot of wrinkles, right? Don't take off those wrinkles. It's maturity. It's masculine. It's like, oh my God, he's like really, hot and happening. Imagine a woman with those kind of wrinkles. It's not accepted.
She's not taking care of herself.
She's looking haggard. Men with larger noses.
Yeah.
Forget everything else. And I'm so itching to name some celebrities, actors who are like really dapper. But if you just look at their structure, they have big noses.
Yeah.
Right? But is that acceptable in a woman? No. It's not. every woman is sort of somewhere insecure about her nose. I was for a very long time, very insecure. I was I have a big
Same.
nose
Yes.
until I made peace with it. So I think, yes, I think men are all, they get away, right?
Is it
And,
also
and
because
one more thing. Although when we define men and women, we say, okay, like men want a good jawline, they can hide it with your beard. Nowadays,
Yeah.
it's a trend.
Yeah, they don't even have a chin. You'll not even come to know they don't have a chin because they have so much of beard. Yeah. Also, do you feel it's more diverse than when we describe good-looking women? Because we feel that now with so much of cosmetic procedures, everybody wants to look alike, same, like with bigger
Oh,
lips and smaller noses and prominent jawline. Like that's not what suits your
no,
features.
no. So
Why are we
this is
trying to
a
put everybody in a
constant.
box?
Yeah. So I don't know, Achal, if I should be saying this, but this has been my constant fight from the time we started doing injectables. And I used to debate and argue at conferences, and say that no, you don't need 8 syringes or 10 syringes, or follow certain, whatever rules and guidelines that are given, because every face is unique.
Yes.
Every face has its own, sort of goods and bads. And that's what makes you what you are, right? So perfection is not beauty, right?
And also, we're trying to preserve your features,
Yeah,
not trying to change it
change
completely.
them. So I think it's so important that when you look at, when you said culture and you said ethnicity, you know, uh, back in the day, I very recently gave a talk on beauty and over the years, the paradigm of beauty. And back in the day, you could actually take out all the Miss Thailand and the Miss Indias and the Miss Americas, and you could identify that this person comes from China or Korea or
Yes.
Thailand or India or, the US or Europe. Now you can't,
Yeah, you can't.
because all of them look the same.
Yeah.
And who's doing it? We.
Yes.
Somewhere we need to put that
Yeah.
stop.
The
We need to put
ethnicities
a
have been
break.
erased, actually.
Yeah. And so where is the beauty then?
Mm.
Because yeah, everybody looks like a doll. You don't want to make Barbies,
Mm.
right? So I think somewhere we need to take a stand and understand that beauty, A, is about uniqueness. Beauty is about having your own, what did you look like when you were in your teens? Let's not make you look like a teenager, but at least, you know, put a little more youthfulness, add a little more youthfulness, and make you look like how you look.
Or some feature that you really liked
Sometimes,
about
yeah,
yourself that you want to preserve.
want to preserve. Now, I will just make one contradictory statement here. Sometimes it does happen that, when you grow up, when you're a child, and as you grow up, there are people constantly telling you, oh, you've got somebody I know where everybody was, oh, you've got a flat nose, you've got a flat nose, you've got a fat nose. Everybody else in the family has got like a lovely nose. And so that sort of really had an impact on her. And when she came to me, I said, okay, let's do a filler and see if you like it, and then maybe you can do a nose job. And she loved it. And the kind of confidence that she got with it. And she was like, you know what, Dr. J, I found myself back. And when she meets me now, she first touches my feet.
Oh.
And so somewhere to do certain things like that is not bad, right?
Of course.
But at the same time, do not cross the line.
And ma'am, I always wanted to ask one thing. Like when a patient approaches you in the clinic, you see something glaringly wrong or something not wrong, something that you could correct, but it doesn't bother the patient at all. Do you
Yeah.
point it out or
No.
do you just let it go?
I let it go.
Yeah. See?
I never point it out, because if it's not bothering the patient, you don't want to make the person insecure, because then you've planted a seed in their mind, and then it'll start to bother them. I don't think it's a healthy thing as
Absolutely.
a doctor.
Yeah,
I don't think it's ethical.
Absolutely, ma'am. This is something that I really stick by because I keep looking at them, if they can bring it out,
Yeah.
they would. But if it doesn't, I just will
Yeah.
not touch upon it, because this is so important, because when they go back and they look at the mirror, they will now start seeing
It'll
something
start-
that they never saw.
They never saw. Yeah.
So
I think I've seen a lot of, patients who, sort of come back to you and say, we stick to you because you've not made us feel like we are these ugly creatures. Because that's what happens then. Oh, I think you have this. I think your under eyes are very hollow. You're looking tired. Or I think maybe your bone structure is not nice. You've got a short chin. You've got this. You've got that. And they end up like feeling so
Exactly,
insecure
ma'am.
about
And even
themselves.
while training, when we are trained for Botox and fillers, we are kind of, trained to assess a face and point things out that you think you can change. But I used to always worry that patient is listening to these conversations, like if you're actually going to point things out. Of course, we are coming from a place of training and learning, which is how it should be. But in a clinical setting, I don't think it's correct to kind of point those
No,
out to the
no,
patient
I
until
don't
it
think.
bothers them.
Yeah. If they come to you with a thing like, okay, I am coming to you for anti-aging, I want to look better. What can you do for me to make me look glamorous? Those kind of patients,
Yeah.
you could sit because they're asking for it, right? But sometimes it really itches as aesthetic dermatologist
Yeah.
that, ye
You
correct
feel
ho
that you
jati
could
hai,
really
you
make a
could make
difference
a
to their
difference.
face.
But then you just sit and say, let's not, maybe over a period of time, if that same patient has stuck to you for a lot of things and, first the skin and then probably is more comfortable and is doing some, skin brightening treatments or some chemical peels. And then at some point, if the patient starts to get comfortable and asks you, you can say, yes, I think,
This is
this
something you can
could
add.
made it.
Should
For
never
example,
be in the
somebody
first.
has really nice features and a very short and a retruded chin, and you could, just put a little bit there or like a drop in the lip or something like that. But I will never point it out.
Yeah.
No.
Shouldn't. And now I just wanted to discuss about the changes that occur in the skin as we age. We only think about lines and wrinkles, but there can be prominence of pores, there can be uneven skin tone that people are not able to point. They just feel, I'm looking dull, I'm
Yeah.
looking tired,
Yeah.
but they're not able to point exactly what it is.
Yeah.
So just to kind of understand what are the other changes that occur in the skin.
So when you talk about skin aging, when you talk about skin per se, what are the things that you see? You see the tone, right? So is the skin on the face or even the body even toned? Or is it patchy, dark somewhere, light somewhere? Is it? So that's number one. Then you look at texture. So is it like a rough texture or do you feel smooth when you run your fingers? Right? That's texture. And then you talked about pores. Now, I have to address this because all of us have 20,000, at least 20,000 pores on our face, and that's normal. Okay? They are normal openings of our sebaceous glands, and that's a form of throwing out the excess sebum or oil that our oil glands are producing. It happens at a very microscopic level. In those with oily skin, it's more pronounced. Now, can you close the doors or do they have windows that you're closing those pores? No, you can't. What happens, why do the pores appear more prominent? Because sometimes you have a lot of oil secretion, and because of which that duct or that opening is fully clogged and it dilates. So it looks wider. When that whole thing the sebum goes out, you have a dilated pore. Or with age, or with a poor lifestyle, or a lot of sun exposure, or a lot of smoking, the collagen starts to degrade. So every pore, imagine it's the opening of a pipe. And that pipe is actually made of collagen. So when the collagen starts to degrade, everything starts to go haywire, and that the opening starts to look wider.
Yeah.
Right?
That's because there's not enough support.
This support is going because the collagen is degrading. So these are the two reasons why your pores appear dilated. They will always be open. And then there are ways to tackle that. Right? So we've talked about tone. We've talked, which is, blemishes, pigment, all of that. We've talked about texture. We've talked about the pores. And then finally come your fine lines and your wrinkles, right? So aging involves all of these. That means how much pigment are you depositing over a period of time because of your sun exposure, because of you not applying a sunscreen when you're indoors, but you have large French windows and 70% of UVA penetrating, right? How much are you abusing your skin by applying 10 different layers of products and clogging your pores and breaking out or developing rashes? How much are you abusing your skin by having a lot of sugar? So there's more process of glycation when you have sugar. And so then the collagen fibers will degrade. So that happens. I already talked about the pores. So that's again a form of aging. But when you look at it, the whole thing amalgamates to one thing: holistic living.
Yes.
You know, so every part of your skin is going to age. Every cell is going to age. Okay, if you don't take care, your melanin production. Melanin is what we have. It's the pigment. Okay, and it increases, and when it increases because of sunlight or because of certain products or an allergic reaction or a lifestyle, even nicotine, you have patchy skin, you have blemishes. That's a form of aging. Melasma, hormonal, okay, and sun. It's a form of aging, right? So you have all of these put together, and not just lines and wrinkles and sagging.
Correct.
At the end of the day, what do you want? You want a nice, even toned, blemish free, radiant skin. If your texture is smooth, you don't have flaky skin, your skin is not too dry, when light falls on it, it reflects back. And that's what shines.
Yes.
It radiates. If your skin is not well hydrated, right? So when I say hydration, I don't just mean drink 8 liters of water or gallons of water, because that's not going to help. You and I know that, right? I always say drink about 2 to 3 liters. It's enough. We need that.
Yes.
But that's enough. But if your skin is dry and you tell me that I'm drinking enough water, your skin will still remain dry, my dear, because you do need to moisturize your skin. Your upper layers are not getting moisture from within, from the water that you're drinking. So if your skin is well hydrated, you use a good moisturizer, in spite of having oily skin, you use a good sunscreen, automatically that process of aging is also somewhere you're putting a little break.
Correct.
So that, because as we age and your hormones go haywire, and especially in women, the estrogen dips, again the skin is very dry.
Correct.
So these are all the forms of aging.
Yes. And also, ma'am, very good point that you brought up, that using too many products can actually be worse, because sometimes what happens is using too many products is also you're exposing your skin to that many potential allergens, and that inflammation is what we call inflammaging. That inflammation can also make your aging worse.
Yeah.
So sticking to a very simple skincare routine is very important, so that you are not kind of overloading your skin with so many products that it actually reacts, and that then in turn leads to more lines and wrinkles, more dryness and irritation.
Yeah. The barrier is compromised. The skin barrier is compromised when you use so many products. And sometimes you don't even know the combinations. In spite of everybody talking on Instagram, you're still using AHA, BHA, retinoids, everything together.
Yeah.
And
without understanding.
Or using so many things that the skin is fully confused.
Yeah. Ma'am, do you feel like aging occurs linearly, or do you feel there are certain age groups where they suddenly start noticing that the skin is aging faster?
I think with social media now, youngsters are very, very particular and very observant. And sometimes overnight they'll come to you and say, I did not have this yesterday and I have it today. So I think it's a perception, and I think how you see it to a great extent. But if somebody has gone through, some trauma, emotional trauma, or has an outdoor activity, is constantly working, suddenly there's a change of work and you're constantly outdoors, or suddenly you've become a chain smoker, so change in habits, change in your work, and emotional change where you're really stressed or unhappy, loss of a parent, for example. Okay, I've seen a man, not a woman, I've seen a man age overnight. I've seen him 3 months ago and I'm seeing him now. He's lost his wife and he's looking like he's 10 years older, right? So there are hormones, of course, the cortisol that all of us know, which will speeden or hasten the process of aging if you're emotionally low or stressed.
Stress
Apart
has a
from
big
physical
impact.
abuse with substance and smoking and all of that. I keep saying smoking because people don't realize, and nicotine in any form, whether it's Juul or vape or smoke, is still
as
going
bad.
to degrade your collagen. Sometimes I'm joking and I tell the patients are like, then what do we do? Like, have a little wine. Though it's not very good that you shouldn't be having red wine every day. Red wine, great, resveratrol, but occasional because that's also sugar.
Yeah.
So anyway, deviated a little, but coming back to the topic. So these are the other forms of aging dramatically.
And also menopause, ma'am?
Yes, certainly. Perimenopausal aging is something which I thought was a sham, but it's not because I'm going through it. So, the mood swings that happen, the hot flushes, the sweating that happens, and that constant stress and anger or crying or depression or, ups and downs will show on your face, will cause your collagen breakdown to be more rapid, will probably increase the melanin in your body and you'll have more pigmentation, will cause a lot of hair fall, will make your nails brittle. So all of these changes, you suddenly start having hollow, sunken eyes. You'll have dark circles. You will have hyperpigmentation. So all these things are definitely a part of hormonal aging and perimenopause. I think men also, they don't go through menopause, but they still have a little bit of a hormonal change where they do age at a particular, point
End
of
of
time.
40s, early 50s.
Yeah, early 50s, they start noticing that, maybe now, if women are starting early 40s, men will be maybe early 50s, where they start noticing the sag, the lines, the pigment, the uneven tone, and all of that.
Yeah. And
balding starts at 16 now, though.
Yes, unfortunately. Yeah. And ma'am, is there any difference in the way Indian face ages as compared to other ethnicities?
Oh, yes, definitely. So there are studies which have shown that the Indian face, be it a male or irrespective of the gender, the skull, is smaller than the Caucasian skull. And, this our face structure, our forehead is usually larger. And our sockets, are generally larger. And that's why we have more under eye hollows at a very early age. So this bone here called the maxilla is slightly more concave in the way we are, and so we are looking as if we're tired. We have under eye circles or hollows even in our teens. And then that progresses. So our structure is very different. Our lower part of the face generally is smaller,
deficient, yes.
And the chin is protruded. So our whole bone structure is different. And our process of aging is a little different from our Caucasian counterparts. Of course, we do not develop wrinkles as quickly as the Caucasians do. That's because our melanin is protecting us.
Yes. The quality of our skin, we are able to retain it for longer.
Absolutely. Yeah. We do not easily develop freckles. We tan more, we don't get skin cancers. So these are the differences. But we will develop hyperpigmentation as we age. We will probably age in a way where our entire facial structure begins to sag downward, because we are smaller faces, smaller bone structure. So when that bone starts to break down, as I said right in the beginning, the face doesn't, the other layers don't have support. And so we do tend to descend downwards.
Yes, and also heavier cheeks.
We're very heavy people.
So that also tends to sag more.
Yeah, we will sag more. We are definitely heavier. We whether it's a male or a female, our structure is such that we are more rounder and heavier, as compared to a Caucasian.
Yeah.
Although I have to tell you that now, with all the new fads and with all the, with social media and with exercise and with all the various kinds of diets that are there, that's also changing. You do see um, a 50-year-old, a 55-year-old woman who looks like she's a Caucasian except for the color.
Oh.
The aging is also happening in that way because of the whole lifestyle, I think.
More protein,
Yeah.
less carbohydrate. Yeah, that does. And also the importance of maintaining weight and that impact that it has on aging is, very overlooked. If you maintain your weight, not gain too much of weight during pregnancy, of course, in a lot of times it might not be under your control, but as much as possible, try to maintain a certain weight. That definitely has a positive impact, because I always see these people, who lose weight suddenly, and it's great. I mean, you should be proud of the weight you've lost, but then they come back saying that now people see I look older, I lost glow from my face, it was better when I was slightly heavier. So that is one of the reasons when they lose fat from the face, the skin tends to sag a little bit. So maintaining the weight is very important.
Very, because, and also if you're yo-yoing, it's not a great thing.
Crash dieting,
Right?
yes.
So you lose weight, then you gain weight, you do a keto, then you do a 16-hour intermittent, then you say, okay, now I'm vegan, then you do this and then you do that.
Yeah,
So that
is the
yo-yoing
worst.
is also very bad for your face. So as you rightly said, maintain that weight, whatever you are, that's important.
And ma'am, what would be the right age to start skincare from an anti-aging perspective?
This is so when a child is born, what are we doing as Indians? We're applying a lot of oil. Okay, so we're moisturizing the child. We've begun the process of anti-aging then itself, right? We're wrapping the child. The child has to be taken out. We wrap the child fully, cover the child. Only eyes are seen, protecting from sun, right? We're putting all those lapes and whatever, basin and this and that. That's cleansing, right? So we've started. But if you ask me, anti-aging, I will say sunscreen, moisturizer is something that every kid, even a kid, should be
using,
right?
Or retinol, let's say, what is the right
so the
age
right
to start
age,
retinol?
So the right age for starting with anti-aging per se, if you ask me, when do you give a retinol to your people? Now, we as dermatologists have given retinoids to our patients even at 16, 17 because they have acne, right? However, I normally start late 20s. That's when I feel the collagen breakdown suddenly starts to be a little faster. The normal cell cycle, which is a 28-day cycle where the lowest cells of the epidermis are coming to the top and shedding, that slows down. So you need a little more help, a little more push to start exfoliating. And because the collagen is becoming slower and sluggish, you want to boost that and give it a little push by adding something. So you add a retinol. And then I add peptides when they're in their 30s.
Yes.
So usually that's what I do. But if they ask me, and if they say anti-aging, I say, sunscreen is the most important anti-aging ingredient that you can think of.
What about vitamin C?
So, so I think, vitamin C is a versatile ingredient, right? It is protecting you from UVA, UVB. It's an antioxidant and, all of that. It's a free radical scavenger. But I have seen that it's a little overrated. It does help with hyperpigmentation, definitely. But in those with acne-prone skin, even if you use the best of serums, I do see that they break down.
Absolutely, yes.
I don't know what your experience has been.
Same, ma'am. Like, I feel vitamin C has been touted as this, panacea for everything that goes wrong with your skin. Just slam on some vitamin C. It's not that. And firstly, it's an unstable molecule. Secondly, not many people can tolerate vitamin C.
Tolerate it. Yeah.
And they have a little bit of irritation that can actually make darkening worse sometimes. And people with acne-prone skin should not be using vitamin C.
Absolutely.
Of course, there are certain like sodium ascorbyl phosphate, which is a little better on oily acne-prone skin. But overall, if you are having active acne or very acne-prone skin, vitamin C is not a good ingredient. So I wanted to ask you this
and
question.
Photosensitive also,
yes.
right? So if you were using L-ascorbic and not using sunscreen over it, it is going to oxidize, so you don't get the efficacy. And the patients will come back to you saying, my skin is looking darker.
Yeah, it's looking dull. Before I started skincare, it was looking better. This is one of the reasons. And also, there are like the 16, 17-year-olds who come to my clinic and DM me all the time asking for, routine for anti-aging because they want to slow it right now. Yeah. Because they don't want to, that's not how it works. Yeah, that's what I wanted to tell them. That it's not like if you start at 15 that you're not going to age. There is a right time for everything.
Absolutely, there's a right time. What I tell them normally is that, listen, this is the time you need to focus on what you're eating.
Yeah.
Right? Because what you eat is what comes here eventually. That's really true. So this is the time when you should not abuse your body. This is the time when you should learn discipline, focus, learn not to stress on, for every little thing. Your exams and stuff, study around the corner. So, my dad he was an engineer, and before every exam, he was a topper. Before every exam, he used to watch a movie, and we'd say, Dad, and he'd tell us also, Kal exam, no studying today.
You should be prepared, yeah.
So that's the whole thing. You bring in a little bit of discipline, eat right, sleep on time, get your circadian rhythm normal. Do not sleep at 10 today, 2 tomorrow, 4 tomorrow, day after. These are very important,
much more important than vitamin
C. Anti-aging than a vitamin C or another big ingredient which is really overhyped is niacinamide.
Yeah.
I'm like, somebody who tells me niacinamide, please, I don't want to listen to it anymore now. Because so niacinamide is like a stick. It's only aiding.
Yeah, it's only aiding.
It's not doing anything directly or treating anything. It's neither a good moisturizer by itself, nor a good,
skin lightening
agent by itself, nor is it doing any anti-aging by itself. So I don't know why people want to use.
Because niacinamide, I think, became so popular because how tolerant people were to it. Whenever an ingredient is soothing on the skin, people tend to use it regularly, stick to it. And then if you stick to anything over time, you will see the benefits. That is what it is. Same with, Korean beauty also. Because the ingredients are so soothing that they want to use it for longer. Yeah. And then you see the benefits eventually.
Yeah.
That is one of the reasons.
That's the thing. Like Korean beauty, I will 100% I'll agree with that. Because it really feels very soft and nice. You wake up in the morning and it's so soft,
absolutely.
So nice.
They have completely mastered the feel of the product.
Yeah.
And how to make the customer happy. They mastered that.
Yeah. So I was watching something, you get these on your feeds, and there was this guy who was rating a Korean product and, figuring out the cost and ultimately saying that, ye to, 100 rupees ka hai. Ultimately, it's a 100 rupee thing which is being sold for like 3,500 or something. Yeah. But the thing was, it's about how you make the person, it's the experience. Yeah. Just when you come to a clinic or you go to a salon, if the experience is good, or you go to a hotel, if the experience is good, you want to go back there again and again and again.
Yeah. And with skincare, because consistency is so important, you have to make sure that the products that you're using is something that you like using and you enjoy using.
Yeah.
Because the results are not going to come overnight.
They are not.
After a year, 2 years, So you have to be regular.
But there's a joke in my clinic when somebody asks me about, I want Korean skin. I tell them you've got to go and live in Korea because their climate is different. Yeah. You've got to eat what they're eating with zero masala, zero oil, everything boiled. And then you've got to genetically have some percentage of their skin.
It's genetics for sure.
And then you do their skincare and you will get their skin. Because otherwise it's not practical.
Yeah. So now I just want to talk about treatments that we offer our patients when we talk about anti-aging. So chemical peels. How often do you prescribe to your patients? How do you like to use it? And do you agree to patients using home-based peels?
Oh, definitely not. The sad part today is that most peels, which are even a higher concentration of
I'm,
whatever AHA, BHA.
I'm being
Everything
sold.
is
Yeah.
so easily available online. Now, I don't know if they are real or fake. That's another question
Mm.
mark, right? Um, but I love chemical peels. I think they're the gold standard. They're always going to stay. We have an international peeling society, uh, you know, where the Americans and the Europeans started it. And it's amazing how we have our conference and we have these things about how you can really transform the skin
Mm.
with just chemical peels. And of course, we are a little unfortunate there because Caucasians respond very well to very deep peels. Like you do a phenol peel and you don't need a laser, all your lines, wrinkles, everything will disappear. You can't do it on Indian skin, we will burn, right? We develop post inflammatory hyperpigmentation. But when used right in the right concentrations, I think they're amazing for texture, for tone, for blemishes, a lot of hyperpigmentary disorders, anti-aging. Now, I'll tell you, Anchal, I don't use those different. You have a platter now,
Now, yeah.
right? But I like my glycolic acid. I like my salicylic acid. I like trichloroacetic, TCA, the yellow, the
The
retinol peel,
retinol peel.
the mandelic peel.
Mm.
So these are my
Yeah.
favorites all the time. I would rarely use a kojic, probably once in a while a glutathione or something just for that party glow, which comes for maybe 24 hours or maybe 2-3 days. But otherwise, I will stick to these basic peels. Now, you asked me how often do you do them? If I have to treat something, for example, if a person has acne and blemishes, which have come after acne, those post acne hyperpigmentary dark spots, then I would probably call the patient for a salicylic or a glycolic TCA combination or a mandelic if the patient has sensitive skin. And I would do that every 2 weeks. Okay. Say for the first 6 sessions. And after that, I call the patient every 3 weeks for, say, another 4. So I do a total of 10, over a period of about 7-8 months.
But just to improve lines and.
So if it's just to improve lines, if you just want to do a chemical peel for the sake of anti-aging, I would call the patient once in a month initially. Do whatever, glycolic, retinol, and just do once in a month for about 4 sessions or 6 sessions. And then do it once in 3 months. When I've achieved whatever I want to, a smoother texture, more radiance, and then I want a preventative thing, I would say, do a mix. So if you're doing a peel now, it's a maintenance peel. Maybe next time you can just do a deep cleansing, like a hydrofacial. It's not mandatory, but if you have oily skin, if you have clogged pores, then you might want to do that. Of course, with peeling also there's a lot of exfoliation and there's a lot of unclogging, and the texture also improves. Salicylic acid will also help your acne and your blackheads and whiteheads. But I don't like to do too many things at the same time. I like to space out things.
Once in a month, yes, and then maintenance once every 3 months. I'm also an absolute proponent of no chemical peels at home. There are these very big brands who have this AHA, which is of 25%, which might be suitable for Caucasian skin, but it's absolutely not for our skin. And you've not understood whether it's going to suit you or not. The pre-peel preparation of your skin. After that, are you applying enough moisturizers? What type of moisturizers? What kind of sunscreen? All this has to be done under professional supervision. You cannot do it at home, I feel.
I think, every peel has to be done in a particular way. Like, for
to get the
example,
results,
AHA
yes.
peels are timed peels.
Yeah.
Right? Then there is something called a hotspot where some parts of your face may be a little, the barrier may be compromised. And nothing's happening on the entire face, but that one spot has got fire. And you've developed like a mark which stays for about 6 to 8 months. And that only a dermatologist can tell.
The early sign of just going maybe slightly deeper or hot spots, that has to be caught immediately.
Immediately, So, and one concentration is not like for everybody, right? You may need a 10%, I may need a 15% of the same peel.
So even though chemical peel sounds like something done very casually, there is a lot of nuance to it.
Oh my
How it's
God.
buffered, what is the pH of the
Yes.
chemical peel, what other ingredients are there, how well the skin has been prepped, what all medications or creams you're using before it, after it,
Yeah.
all that has an impact on the outcome of the peel.
Yeah.
That people need to understand.
Yeah. Also, home remedies.
Yeah.
They end up doing chemical peels and then they
Then,
end up
oh.
putting nimbu and God knows what all on their face. So that also will sort of play havoc.
Correct. And ma'am, what do you think about laser toning, like Q-switch lasers? How often do you do them?
I've been lasering since 2004. Like I was one of those buyers back then. And we were doing it every month. So if there is a hyperpigmentary disorder also now, we do it only once in 2 months. For a tattoo removal, it would be once in 2 or 3 months.
3 months. Yeah.
So when you talk of toning, even though when we say toning, it's basically a Q-switch Nd:YAG laser, for the audience to know that it's a Q-switch Nd:YAG laser that is, it has a wavelength of usually a 1064 nanometer that we use. And it targets the melanin in the skin. If there's a hyperpigmentary disorder, which we think can be treated, we'd probably call the patient once in a month initially or once in 6 weeks, right? But when you talk of toning, the energy is much less, okay? We call it fluence. So that is much less. So a lot of times people tend to call you every week and do it. And there are papers also which talk of how melasma you can do very, very low fluence, low energy, call the patient every week and do it. But in my experience, since 2004 to now, almost 20, 21 years, I think we should slow down.
Yes.
I think the intervals need to be longer, even if it is laser toning.
Yeah.
I would say once in 2 months is very safe. Okay. But you can also probably, if there's a bride and you want results, you can initially space them at 4 weekly intervals. Initially space them at 4 weekly intervals. And maybe after 4 or 6 sessions, then call them once in 2-3 months.
Yeah.
So in my experience, then I've seen that the skin stays healthy, and otherwise sometimes their barrier is compromised. They do become a little sensitive, and sometimes they keep getting these eruptions again and again and again. So lasers are amazing. I love lasers, but they are tools which have to be used the right way. It's like, we call them our toys, right? All these gadgets that we have. But everything on the wall should not look like a nail, that you have one hammer and you're hitting everything with that. That's not how it should be. So if you have a list of ingredients and you're a very good chef, you will not put every masala to make that cut, whatever, curry. You will only pick and choose the right ones. And that's exactly what we are also going to do.
Correct.
Right?
Ma'am, what do you think about IPL? How often do you like to do it? Is there any specific skin concern you like to address?
Yeah. So when we're talking of laser, it's a light, right, with a stimulated emission. Whereas IPL, intense pulse light, is also light, but it converts into heat. Okay. So the wavelength is different and it's very vast. And that one light has many wavelengths sometimes, from 400 to 1200 nanometers. Laser is very specific.
That's why IPL is also called broadband light.
Broadband
or
light.
IPL.
Yeah. So laser is very specific. One will target only pigment. One will target only the water. So it's going to work on, lines and scars or something. So one will target. So it's got like different targets, different very specific wavelengths. Intense pulse light or IPL is such a broad band that it's very good for, a lot of things. You use it for hair, you use it for pigment, you use it for rosacea, you use it for, so very good. But the repercussions of post-inflammatory hyperpigmentation are very, very high in Indian skin, in our kind of all shades of brown. Yes. So you have to be really more careful when you're doing an IPL. I think once in a month is what we would generally.
Yes, ma'am, once in a month. And also for people who have prominent blood vessels, rosacea, it works really well.
It works well.
So it's something that is like a niacinamide, doesn't target anything specifically, but is okay, kind of improves all the concerns a little bit.
Yes.
It also tightens a little bit. It makes your
Yes.
open pores look a little better. Makes your dark spots look a little lighter. But
But you have
does
to
not
use the right
right
parameters.
parameters.
And I have to tell the viewers that we're talking of chemical peels. We're saying we love them. We're talking of lasers and IPLs. Any of these treatments, when you do them, the post care is very, very significant and very important. So, no scrubbing after that for a couple of days. So, for every treatment, your dermat will tell you that, okay, if it's a peel, your skin is exfoliating for 2-3 weeks. So, you should not be exfoliating on top of it.
Yes, and no home
You know,
remedies.
no home remedies, no going out in the sun without your sunscreen. So, whether it's a peel or a laser or an IPL or a microneedling radio frequency, you still need your sunblock. I'm not saying stay within the 4 walls. That's only when we do very intense ablative treatments. But don't forget your 2 fingers of sunscreen, because again, when we say sunscreen, people are applying this much.
Yeah, pea-sized amount.
So, yeah, pea-sized amount. I don't understand. It's not going to work. So, 2 fingers of sunscreen every 2 hours if you're outdoors, especially when you're doing all these treatments. Also, when you are, exposed to a lot of blue light, whether it's from the sun, when you're indoors, visible light, or blue light from your laptops over 2 hours, over 2-3 hours, you still need sunscreen, which has a little bit of iron oxide in it, tinted sunscreen. And that's really mandatory when you're doing all these treatments. Because otherwise, Indian skin tends to pigment.
Then you feel that it's looking
the
worse.
best doctor, the best clinic, the best treatment, everything has happened. But after that, you've gone and, you're swimming in the beach immediately after. Maybe, no, I did it about 24 hours later, 2 days later. No, I think 4-5 days to a week.
I would say a week,
You have to be careful.
And ma'am, what about fractional CO2 laser? Where does that feature in your anti-aging armamentarium?
So, I use fractional CO2 and fractional erbium, fractional diode
All the
now.
fractional.
All of them. But I love to use them more for scars, acne scars, traumatic scars, stretch marks, surgical scars. I think they're just beautiful tools for any kind of scars, which probably make you feel a little insecure. If you love that one scar on your face, it gives you character, keep it. Right? But at the same time, there'll be some people who'll come to you. You will be seeing 2 big scars there, which don't bother them. There'll be one tiny something here that will bother them. They'll say, this one.
Because that would have been there for many years. That they've accepted.
They've accepted. So anyway, so coming back to CO2, I love it for scars. In terms of rejuvenation, if I know that my patient is compliant, my patient will make sure he or she does not use 10 products after the treatment and is okay with that redness, and there's a lot of redness.
The downtime, yes.
There's a lot of
7 days.
those little scabbing and all of that, which happens for about a week. So for that 1 week, you really have to be able to afford that time to sort of sit indoors, to sort of lather yourself with moisturizer, with sunscreen, no exfoliation, no hot water. So if you are able to do all of that and you are not, and you're compliant with your skincare, post-care, and you're not one of those who gets really anxious,
there is a downtime.
And you are not a picker. Because if your skin scabs and you constantly are a picker, you're going to have post-inflammatory hyperpigmentation. So I think, now I do not do CO2 for anti-aging. I do it only for scars, because I have seen in my practice that most of us Indians, for us, it's not even practical to sit indoors except for people who are working from home.
That's true.
And the chances of post-inflammatory hyperpigmentation are so high that, and we have better devices.
No, correct.
We have
We'll
better
move on
devices
to that
now. Yeah.
So what about microneedling, derma roller, at-home derma roller, in-clinic derma roller, and then we'll talk about microneedling RF.
So I'll tell you a very interesting thing, actually. In 2006, I went to Melbourne for a conference where I was speaking on radio frequency skin tightening. And I was the first to bring radio frequency skin tightening to India in 2004. I brought this device and from Bangkok, I carried it with me and all of that, brought it. Dr. Rekha Sheth, late Dr. Rekha Sheth, one of my mentors, I love her. So I went to her and I was doing a couple of treatments. And then I went to her and I was like, this is a new device and I want to talk about it. And she was very gracious to say, okay, we have the Cosmetic Dermatology Society of India and the conference is coming up. Why don't you talk about it? Um, and she gave me a platform and then it took off from there. So that's how I was, the first to talk about. Nobody had heard of radio frequency. If Thermage, people had heard of Thermage but hadn't come to India. So it was that. And then in 2006, again, I went to Melbourne, got the derma roller. Nobody had heard of derma rollers here, And by then, I was also a part of the CDSI. So again, I told ma'am, now I have another gadget. So she said, go for it. So then I had conducted workshops and all of that. And it was very interesting because the derma roller, when used right, a 1.5 millimeter to a 2 millimeter depth, used right, would give definitely a textural improvement, an improvement in some sort of scars, not very deep, but very, very temporary results.
So today,
So
if you
now,
have to choose, between a derma roller and a derma pen.
I went back a little nostalgic and a little history because these are two things which I brought.
Interesting, yes.
But I would not recommend anyone to use a derma roller at home for the simple reason the chances of infection and scarring could be very high. And I have seen that, and I'm treating that in a lot of my patients who have gone wrong with the way, the technique in which they use the derma roller, because they're needles at the end of the day. Sometimes they are using the same roller again and again and again. They don't know how to sterilize it, and so then they develop infections. And sometimes you have these, methicillin resistant staph, which sits on your derma roller and then you're putting it back into the skin and then you're passing it on to everybody. It's scary.
Yes, ma'am. I've also seen very bad scarring. I think the cheeks are still a little forgiving. The chin and forehead can scar very badly if you're not doing it correctly. The direction has to be correct. The pressure has to be correct. The depth has to be correct. So absolutely no derma roller at home. I feel like maybe, if you want to use derma roller for the scalp, I would still kind of like forgive you for it.
You've
like,
taken,
that's still okay. If you want to, if you're, well versed with how to use it, it's still okay. Not on the face. Not on the face.
Definitely not
also,
on the face.
I think because the derma roller or the derma pen gives that instant edema, swelling, so they feel that the scar is suddenly improved. But that is just a temporary effect. It's just fluid collection, which is going to then drain out. But that's why they tend to use it at home. But no, you should not use it.
You should not use it.
Not at all. Correct. And now, if you have to choose between micro needling and micro needling RF, it's easy choice. But what would you?
So micro needling is usually with a pen, right? The derma pen that we use. And microneedling RF is basically a device, whether it's a Morpheus 8 or a Secret or a, Endymed, so many devices now in the market. It's microneedles with radiofrequency energy. Now, both have their own place. If you ask me to choose, I will not. I would probably say I can't because it's very individual. So if a younger person comes to me, does not have scars, does not have lines, does not have anything, but has some little bit of acne, blemishes, or wants to look like a little more, maybe she's in her 30s and has very superficial scars or has some blemishes. I would love to do the vampire facial, which is PRP with microneedling. These days, we do a lot of microneedling with exosomes or with PDRN. So I would keep it for people who don't have a lot of sagging, people who don't have very deep scars, acne scars, more superficial scars. Really helps with keloids. You can't use a heat energy based device for a keloid. Sometimes it just comes back.
Flare.
So I would rather keep my microneedling device for that. Or sometimes for maintenance, people just want to come back and say, okay, doc, I want my skin to look youthful. I want my pores to look less prominent. I don't want to develop fine lines. I would do the derma pen. Microneedling RF, on the other hand, is my go-to tool when it comes to acne, scars, or stretch marks. I always combine, and we all do. We combine treatments. So we would probably do subcision and microneedling RF with PRP
fractional
or
CO2.
with CO2 or with fractional erbium. Nowadays, I am also using a lot of the diode, which is, you actually have a wire which goes below the skin for the audience. So the endolift, which helps a lot. So, microneedling RF has its own place. So if you have either you have very deep scars, you're very young, but you have very deep scars, the derma pen may not help, right? Or you're slightly more mature, you've crossed 35, 40, you have scars and you have a little bit of sagging, it's just about beginning. It's
Works
a
very
wonderful
well.
tool because it's radio frequency, which is heating your collagen and tightening the skin. And those needles are sort of breaking the fibrous bands and also making way for whatever, solutions that you want to pour, whether it's exosomes or, PRP. I want to tell people here that don't use a derma roller and just use any serum.
Yeah, very important point, ma'am. Yes.
Because when you use any random serum, it's not going to penetrate very deep. It's going to stick in there, and then you may develop granulomas.
And also, ma'am, these serums are meant to sit on the skin. They have certain preservatives, certain emulsifiers that are meant to just sit on the skin. You can't just use any serum with a derma pen because the meso solutions, as we call them, they are prepared a different way. They are packaged a different way. They have to be used a certain way. So you definitely cannot just use serums with derma rollers. Absolutely not. And ma'am, what is this news? Not new, but a lot of misinformation about MNRF causing fat loss.
Yeah.
And people are worried about doing MNRF because it's causing fat loss.
I'm sorry here, Archel, I'm going to be a little bit of a bummer, but I think slowly Instagram is also becoming very vindictive.
Yeah.
Right?
It is.
So somebody who likes a product will say this is very good and doesn't like the product will say, oh, this is the worst product. The person may be the best influencer or the best or a very good dermat or whatever. Or a lot of times it's, paid promotions or whatever. And a lot of times it's just to pull the other person down or the other fraternity down. It's a constant war between, say, I don't want to say it, but there's
between
a war
two fields,
between two fraternities. There are two different fraternities. So if I know my skin because I'm a dermatologist and the other person knows how to cut well, you should not be showing each other down.
Yeah, because
and saying, oh, this is happening. Oh, fillers are causing this and MNRF is causing fat loss. Now, if you are going to use a very high intensity and needle depths of maybe 6 mm on the face, which is insane. I don't think a sane dermatologist who is qualified will do that. Now, when you use a microneedling RF tip of 3 mm, the 3 mm does not go, the entire 3 mm does not penetrate. A part of it still is stuck to the, to the cartridge. So maybe 2.5 mm. So the other day, I heard an Instagram reel where this very famous, everybody's following him, person, he's a surgeon, and he's talking about how microneedling RF is bad because, he says, the cheek skin is 1 mm and you're putting in 3 mm. I'm like, here it'll be at least 2.5. I understand if you're saying under eye, it's 0.5.
Eyelids, yeah.
Maybe eyelids, you're saying 0.5. But you can't say the cheek is like 1 mm. So you don't even know your facts, right? And you're a very famous, so to say, doctor who also has a chain of skin products and who's also cutting all the time. So I beg to differ. So if you use the device the right way and you don't go, beyond a certain depth and you don't increase the fluence insanely, which we will not, because as it is, we are Indians. Shades of brown, kuch kiya to kala ho jata hai. So we have to be careful on that. So when we're doing that and using it the right way, I don't think it is going to do anything to your fat. Right?
Absolutely.
Now, I've read a lot of comments saying, oh my God, that is why I've become gaunt.
Yes.
And all of that. Yes. And then I've seen them. They're all fair-skinned people. Right? And back in the day, I know for a fact that when they had introduced certain devices, I don't want to name them, they were actually anesthetizing the patient completely, fully, because it was excruciatingly painful. And they were really going deep and they're going very intense. And that's why maybe those patients experience that fat loss. It doesn't happen with us.
Yeah. So that is why I wanted to do this podcast with, veterans like you, because there's so much of misinformation out there being given by even experts
Yeah.
from other fields. So, just to break that myth, because I
Yeah.
think people need to know the available devices and also how it can be used, and what are the downside as well as what benefits can be there, because we are focusing so much on the downside that people who can really benefit with MNRF are now scared of doing it.
Yeah.
I'm not saying go and get every treatment done under the sun. Of course not. You have to be evaluated properly. But getting the facts right is
Getting
important.
the facts right is important. Now here, I'm going to be, trolled for this maybe, but I have to also tell you this, that the flip side to it is that there are a lot of clinics with unqualified professionals who are using devices like MNRF, or who are doing fillers or botulinum toxin. We don't even know what brand, what, stuff they're using. And then somebody might just say, oh, but I'm an Indian and I have lost fat. Well, please check where you've got your things done.
Yeah.
That's also very important.
Yes, ma'am. That's why this people not looking for actual qualifications of doctors, and they feel that they're going to a dermatologist, but they aren't a dermatologist. Getting the treatment correctly, following all the procedure, post care is also very important in order to see results. So it's not like we cannot just give a bad name to a device or a procedure. It's just how it's done. When it's done right, it's great. And when it's done wrong, of course, you will see the side effects. Now, I just want to touch upon skin tightening RF and HIFU, because we do that, we do recommend, but not many people know what HIFU can do, and what skin tightening RF can do. So just a little bit of details.
Skin tightening RF, is close to my heart. I
Yes,
brought it to India in 2004.
So you're the expert on this.
So I think, it a lot, basically it's radio frequency energy. So it's heat energy. To the patient, it feels like a warm massage, or sometimes a hot massage if the device is so. And that gets into the layer where you have your collagen, and it tightens the collagen. It stimulates those cells called fibroblasts to produce new collagen over a period of time. Now, based on the type of device that you're using, you either do it every week for 6 weeks, or there are devices which say do a session once in 3 months.
3 months.
So there are these two types of devices. There are many in the market. I think they're very safe when you're doing it right again. So using the right energy, again, we come back to the same thing, is very important. I like to start my radiofrequency skin tightenings at an early age.
Okay.
I start them at 35. I sometimes even 32. Right? I mean, if I see that, okay, this is the pattern of aging in the family, or this person's lifestyle is very hectic, or this person is, going through a lot of mental whatever, I will start even early. So I'll start at 32, 33. And I will finish my course of, if it's my device where I have to do a session every week for 6 weeks, I finish that. I do not then say, okay, come back every month. Why? Because that collagen remodeling takes about 3 to 4 months.
Yes.
So attacking it again and again is also wrong. So finish the course and then wait for about 3 to 4 months. And then you can do maybe one session of a touch-up. Now, the beauty of radiofrequency skin tightening is that it is colorblind, right? So it does not read melanin. So you may be any shade of brown, from the lightest to the darkest, from the north to the south. RF skin tightening is not going to cause any damage in terms of post-inflammatory hyperpigmentation or scarring. What can happen, what can go wrong, could be that if your energy is high and the probe is here and you touch the probe and you basically move it on the skin like this, it's like a massage with. So if you're not touching and your foot switches on, sometimes there can be a spark and there can be a burn. But that is very, very, very rare. It doesn't happen if the technician who's doing it or if the doctor who's doing it does it the right way. Otherwise, I've really not seen side effects if you do it the right way. Again, a lot of people feel that you become gaunt. I don't think so, because it is only stimulating it's not going too deep. These RF devices are not going to the level of your subcutaneous tissue. So unless you're using one or two, which are like, I think there's only one which is quite extreme. I don't want to name it, but we all know that there's one which is extreme, which is done once in 3 months. It's an amazing device, but use it the right way.
Yes, ma'am. Like how we discussed about the differences within Indian features and how they age, we also discussed how Indians are slightly bulky. So for that, we do prefer to use HIFU, high intensity focused ultrasound. But not many people know about this tool and how it can be a really good tool for anti-aging. So just a few things about how you like to use HIFU.
One of my favorite devices. When people ask me, I am going to be 52, and people ask me, what do you do to your face? You must be doing a lot of stuff. And I'm like, I do things. I do two things around the year. I do Profilo, which is a skin booster, and I do HIFU. And I'm very regular with it since 2019. So, high intensity focused ultrasound. It's basically ultrasound energy that is going into the deeper layers of your skin, and also somewhere also reaching this mass and trying to sort of regenerate the entire facial structure and collagen which is there. Again, people feel that it takes off fat. Now it depends on what kind of a cartridge
Depth
you're using and the depth that you go to. And then it's a very technique oriented device, like the radio frequency. If you do it right, beautiful results. If you say this is a HIFU facial and you do some random thing and charge less because you're only doing some 300 shots and doing some big facial, it's not going to get results. It's not going to give you anything. So that's again, people are getting misguided. The actual thing is the right number of shots, which differs from patient to patient. So basically, how do you do it? You apply a numbing cream and then you shoot the ultrasound energy on the entire face, on the, on the chin area, on the neck, the forehead, and you can very beautifully cause a little bit of raise in the brow and a little bit of lift here. It's really good for people with crinkly neck. There's not much you can do with the neck, right? Other than a microneedling radio frequency. I think a HIFU is an amazing device, and especially Indian faces. We talked about this, where we said Indians age where we are heavy. We're heavy faces and we're dropping down. Okay, I shouldn't be using the word, but like bulldogs, right? That's how we're aging. And we're generally heavy. And so you can't put fillers there, and you can't put threads also because the threads will get lost in that fat. So what do? You have to use energy-based devices. And a combination of a HIFU and an RF, a non-ablative, non-surgical RF, can actually, maybe not give you like that kind of a stretch, maybe not give you like a 100% facelift effect, but it's a good treatment to do to actually maintain that little bit of tightening and firmness on your skin. And you do end up getting a jawline.
Yes.
I don't have anything else. There are no threads here. And I think my jaw is pretty well defined. Guys, please tell me if it's well defined.
Yeah.
But, and this is happening with a Profilo and a HIFU. Much to all the Instagram posts that you see where you say, there are doctors who are saying that, oh, these energy-based devices do nothing. I am really sorry. I have been using energy-based devices since 2004, and people who are consistent still look the same, even without any surgery or any thread lifts or any deep plane, surgical treatments, or even fillers for that matter. So I think they're an amazing tool, good for heavier faces.
And also
now
for double chin.
Yeah.
I feel it's so good to kind of debulk it a little
Yes.
bit. That itself gives them a nice jawline.
Yes.
Also, the jowls are very difficult to treat.
Very
So if you have a genetic predisposition to develop marionette, or people in your family have very strong marionette lines,
heavy
jowling,
jowls here,
and
this
a deficient
hanging down.
chin,
Yeah.
doing a little bit of HIFU in this area can tighten and delay that.
Yeah.
And give a very subtle but appreciable change.
It's a very, very, very well put, very appreciable and very subtle change. So you look like yourself and people will say, बहुत अच्छे लग रहे हो, क्या किया है? But ऐसा मतलब या फिर समझ में नहीं आता कि कुछ किया है.
हाँ, you will
You
not be
know,
able to point a
you
finger as to
can't.
what has
You
changed,
can't.
but they just look younger.
Yeah.
And for double chin also,
So
it's really
it's
good.
really good. It's good for the neck as well. So somehow, we have to let people know that energy-based devices, but yes, you have to be consistent. You do one session and you say, oh, I didn't see any results. Well, one session will not give you a result.
What is your
You
plan, ma'am, for
So what
HIFU?
I normally do is anything between 1200 to 2000 shots for the face and neck, and I repeat it after 3 months.
Okay.
And if it's a heavier face, I do like to do RF in between. So I will call a patient every week for an RF, or every 15 days, or every month, depending on how the patient's face is. And then I do, and sometimes the patient cannot come for an RF. That's also okay. I will do 2 sessions of HIFU in a year, 3 months apart. But that second session, which gives a kick to the first, will really give you that good, that final result. Number one. Number two, HIFU is not something which gives you instant results. You have to have patience. In today's day and age, everything they want is instant. And that doesn't happen. It doesn't happen with Profilo. It doesn't happen with HIFU. You do a HIFU, you sit back, you wait for 2 months, 2 to 3 months, and then you start seeing a difference. Same thing with the non-surgical radiofrequency also. Yes, you see an immediate nice tightening for about a week. So patients will say, oh, bahut acha tha, it looked very nice, but it went away in a week. No, that immediate tightening is because the collagen fibers, which were all like this, have suddenly tightened with the heat. Okay? And then, and there's edema. Edema means swelling. And that's because there is a little bit of wound, that is created. And then there's inflammation. And so with all of that, there's a little bit of swelling with a little bit of tightening of the collagen, which stays for about a week. And the skin looks fab. And then all of that goes back. And then the normal new collagen starts to build over the next 2 to 3 months.
So, ma'am, what schedule do you follow for HIFU?
So normally I will do a session and call the patient back in 3 months and repeat a session. I tell them that you will not see results with one. Okay. The second thing is that you don't see instant results with HIFU, right? You have to wait for the neocollagenesis. That means new collagen formation, which takes about 2 to 3 months. What is HIFU? It's heat, ultrasound heat energy, which is going to stimulate the collagen fibers and the cells, the fibroblasts, to make new collagen. Now, what happens immediately, when you do HIFU, there's a little bit of wound that is created in the deeper layers of the skin, and there's inflammation, because of which there's a little bit of swelling, right? And the immediate collagen, imagine wo aise सिकड़ गए हैं, वो suddenly they open up and they become tight. So for the first 1 week, the skin looks amazing. The same thing happens with a non-surgical radiofrequency device. But after that, everything goes back to square one. So the patient thinks, oh, it only lasted for a week. But that's not the truth. Because the actual result will only start after 2 months. After all this inflammation settles down and the cells start producing collagen. Takes about 2-3 months. And then you give it that second push. After 3 months, do another session. That's my protocol. I follow about 1200 to 2000 shots for the face and neck. Depending, it's very patient dependent. And sometimes if the patient is very heavy, then between 2 HIFU sessions, I will do radiofrequency as well. It could be, depending on the device, once in a week for 6 sessions, or once in 15 days, or even once in a month. So that's my HIFU protocol.
Yes, ma'am. So that's also how I follow it. But yes, it's important to understand that each of these devices have a specific role.
Yeah.
So, when patients come to us in the OPD, they have a fixed notion of what we are going to tell them. They are not aware of all these devices, and also they don't know what can be achieved, and they want to just choose one. But it's never like that.
Yeah,
it has
it's
to be a
never one.
multimodality approach.
Always.
Firstly, we do something for the skin, then improve your skin quality, and then maybe I add in some boosters, which we'll talk about, and then go deeper with RF and HIFU. And then when we combine all these procedures is when we get a good result.
Yeah. It's always like that. Whatever you do, whether you're making a building, okay, You can't just paint. Now you look at this, this has got these beautiful Victorian motifs, these molds or whatever, right? Imagine a plain wall here. So the person has not just painted, the person has added some little stuff here and there. Same thing goes with our clothes. Why are we forgetting? Why should there be one skin cream or ये बाद में नहीं होना चाहिए? This should be permanent. No, skin is the largest organ of the body, and it's this constantly changing and it's aging, and it can also have its own set of fungal infections and allergies and eczemas which will come and go. So which is why you need combinations and you need to repeat sessions, and I think these treatments like HIFU are now really being talked about by a lot of uh, other fraternity colleagues, saying, oh, they don't do anything. I have been using these devices since 2004, and people who are very consistent have maintained their facial structure. We've been able to retain that facial structure without having to go under the knife, without even doing some heavy thread lifts, lifestyle, basic skincare, and just RF HIFU. Maybe a little skin booster here and there, maybe a little laser for skin brightening or, evening out the skin tone. So these energy-based devices have a huge role to play, a positive role to play, without giving side effects, if you know to
And
use the
without
device.
making you look unnatural.
The beauty of HIFU, koi downtime nahi hai.
Yeah.
You do a HIFU and you walk into another event or a party or whatever,
Nobody can tell. Yeah.
Which is why I love it.
Correct. So now we'll move on to another category, injectables. Why are Indians so scared of needles? Whenever we suggest anything that involves needles, they're like, nahi, needles nahi. Injection nahi dena.
I
Why
don't
is
know.
it?
हमारे genes में कुछ problem है क्या? There's something in our blood.
Because they have done a study where they have looked at various ethnicities and they found that Indians are the most scared of needles.
I don't know if Indians are also very superstitious, and they feel that if you put something into the body, with the help of a needle, not an external thing, but inside, it is going to harm your body, it's going to give you cancer, which is not the truth. There are innumerable studies now over 2 decades which talk about injectables and their safety when done right, and when we follow the protocol of less is more. Right? I don't know. Sometimes even I wonder, क्या genes में कहीं कुछ था?
I think also,
what is it?
As kids, like even I do that to my child also sometimes. Whenever they need to be, disciplined, we say, "अरे doctor के पास जाके injection लगा देंगे." So that injection लगा देंगे, I think it remains in their head, and they feel that is maybe like the most painful something can get.
Yeah.
So that's why they're always scared of injections. Could be.
Very much.
And ma'am, why does
Also,
Botox?
But also these days, when people are, scared of injections, when you say Botox on fillers, they'll say no, because of all the botched faces that they see on social media, unfortunately. And I was talking to somebody and saying that, they don't see the good faces because they don't come to know that
good Botox goes unnoticed.
Yeah, a good Botox or a good filler goes unnoticed. People don't know कि ये किया भी है. Although उस बंदे ने, every year कर रहा होगा वो, but वो इतने अच्छे से किया है कि समझ में नहीं आता. You understand? So you only see the bad, and that's bad luck for us, boss. I think, we need to make them aware that you can really, use botulinum toxin or a filler the right way to recreate that youthfulness on your face without looking unnatural or unattractive or done.
Ma'am, how often do you give botulinum toxin?
About once in 4 or 5 months.
But
That's
do you
my usual protocol.
Ask them to take it every 4 or 5 months, or you wait for the muscle activity to come back, wait for a few months and then inject?
Always wait. Usually it lasts only for about 4 months, but there are some patients, having said that, who come once in 6 months, 8 months, because it does last a little longer. So Yeah, the usual protocol is once in 4 months, but it also entirely depends on whether the lines are back, whether the muscle activity is back. I don't wait for it to come back 100%. So, when there's just about movement, and instead of seeing those two folds become very deep, it's just about start seeing them after 4 months, you attack it again and you basically relax the muscle again. But I don't do it in 2 months and 3 months. I don't do it that often. Sometimes, I mean, there are reports of antibodies that develop if you do it way too often, if you do it every 2 months, 3 months. So it's nicer to wait for a bit and allow that muscle, to get back its movement and back into action, and then slowly back into action, and then again, you know,
Then
attack
target
it.
them.
Yes.
And what about fillers? Like, which area do you prefer the most? What type of patients do you think require filler or will benefit from filler? How do you approach? Is it just for balancing, or is it for, because we know fillers will not lift the face as such, because for that you need a lot of amount, which is something we don't go for. It's more for balancing. But there any areas that you prefer to improve with fillers?
So, I love doing fillers. There's a thing that isko 3 baje raat ko bhi utha do, she will do it just the way she wants to do it, because it's an art, right? It's science and art put together. It's an amalgamation. In fact, I would say all our aesthetic treatments are an art. And if you do it the right way, a filler for the audience is not Botox, right? Botox is a medicine which is injected into the muscle, relaxes the muscle. So your lines here, your frown lines, the forehead lines, the crow's feet, they will sort of become less prominent for the next 4 months that you've given Botox. A filler, it's called a filler because it is a syringe. A filler is basically a pre-filled syringe of either a 1 ml or a 2 ml of hyaluronic acid that is available. Now, there could be other, apart from hyaluronic acid, there could be Radius, which is calcium hydroxylapatite. Then there are some PMM A and PLLA and all these other things. Sculptra is there, which is a biostimulatory agent. But we use hyaluronic acid in India. And I love to do it for thin lips, to define the lips, I don't mean create duck lips, just about add a little bit to make the lips look attractive. As we age, our upper lip tends to thin because the bone here and the fat is going. The teeth are also sort of becoming, you're losing your bony structure and support there. So this, and the muscles get weak, the muscles which are holding up the lip. So this lip tends to roll inwards and it becomes thinner. And that's when, if you put in a little bit of filler there, it just brings back the youthfulness on the face. So that's something that I love to do, even in men. Even in men. The second would be, somebody with a retruded chin, genetically or with age also, right? So when you age and this bone is going behind, there's more sag. So if you just recreate a chin to either aesthetically improve the patient's face in a profile view, you'll see that it's not just going behind like that, but there's a nice projection that looks very nice in younger people. And in older people, it just gives you support. So these folds, when you have heavy marionette lines, just doing those Instagram viral videos where you're doing Botox here and here and Nefertiti, this is not going to improve. Excuse me.
Yeah.
You need other things. So that's when I will create a chin again. Men, they love a robust, nice chin,
And
strong
jawline.
chin, a strong jawline, that Brad Pitt look. So I love to recreate the jawline and chin for men. Now, Indians per se, we discussed, we have tear troughs, we have under eye hollows. And sometimes patients come to you saying, we sleep so much and still we look tired. That's when you look at the bony structure. Sometimes they'll say that they've got dark circles, but they don't. It's a shadow. Light falls and it casts a shadow. So in such a situation, or as we age, what happens? The bone here, the socket, it starts to go first here and here, near the, the upper side, near the nose, and laterally, on this on this corner here. So then you start seeing sockets here. And so you want to refill that to take away that tired look and that haggard look. So I would do an under eye filler. Now, a lot of people are very scared of doing under eye fillers, courtesy, again, all the reels which are doing the rounds. The reason is that you are doing either heavy fillers, or you are going very superficial, or you're putting too much of the product. Under eye fillers have to be on the bone, they have to be very light fillers, and always undercorrect. If you think that one syringe is enough, then do half a syringe. If you think two syringes are enough, then do one syringe. Because it's hyaluronic acid, it's going to absorb a little water, it's going to swell up a little, it takes time to settle. And the other important thing is, don't do it every 6 months and every year. If it's the under eye, you need to wait. I wait for 1.5 years. And as I repeat the fillers, I see that my intervals increase. I might do it once in 2 years also. Right? Now, when you talk about the lip, initially it'll last you for 4 or 5 months because it's a very mobile area. You're talking, you're eating. So you have to probably repeat it in 4 months. But then hyaluronic acid starts stimulating collagen. So then it starts lasting longer. It'll last you for 6 months, 8 months. I have patients who come once in a year, once in 1.5 years. So you've got to slowly gauge. There are patients who've come back and said, oh, you called us after a year, and I'll look at them and say, well, I don't think you need it now. Go back. So you have to gauge and then do it. Don't just do it because math and science tells you that you have to repeat it in 6 months or 1 year or whatever, 8 months. No, your repetition, your intervals should depend on what is the face looking like. Is the filler lasting longer? So these are my main areas. I also like to do fillers in the temples because they give a certain amount of little bit of lift at least. Also, when we age, the bone here, the zygomatic arch, it tends to become a little flatter. So that nice cheekbone, that arch tends to go. So you want to put in a little, gives you a little support, not much, but it adds that youthfulness, even in men. So now I will not put volume here. I don't like to add volume here and create those apple cheeks. If somebody comes to me and says, I want my deep folds gone, it's impossible. If you have subtle lines, I might add a little here. It's enough to lift this. And then I might put a little. We're all born with laugh lines. They only get deeper with age. So then I'm not trying to correct you with fillers, But for all these others, if I know that whatever I'm doing, I'm going to do less, and I'm going to keep my intervals good, and I'm going to add other treatments in combination to be able to create that natural, attractive, youthful, and well-balanced look. That's the beauty of fillers.
Ma'am, does the filler migrate or dissolve? This is like a discussion that has been going on, that actually fillers don't dissolve and they just migrate and sit somewhere else.
So it depends on the type of fillers that you've used, number one. So if you've used hyaluronic acid, if you've placed them at incorrect positions, for example, I just said the under eye area, you have to place it on the bone, and you have to put something really light, and you have to make sure, you're not overdoing it. If you put a lot of stuff, it doesn't have place, it is going to migrate, right? If you fill a bucket and you keep filling it and you overfill it, it is going to fall, it's going to overflow, and it's going to fill the entire floor. So your quantity should be less. And you cannot put something heavy in an area where you're supposed to put something light. It will migrate. If I end up putting a very high G prime, a heavy filler on my lip, it's going to go into the upper lip, in this part of the lip. Or if I keep doing it, repeat it every 3 months, जगह ही नहीं है यहाँ पे यार, migrate तो हो ही जाएगा. You understand? So if you keep your intervals longer, and if you do the right amount and the right type of filler, it will,
and the right technique.
The right technique, oh my God, the right technique, the right level is so important. If you're putting that much, it does dissolve. But if you're overdoing it, there are chances of migration. I don't disagree on that.
Mm.
So both are happening.
And ma'am, what do you think about people who are scared of doing filler because they feel that they'll have an overfilled face and that their face will look puffy?
I missed this point when I was talking about under eyes. If a person has the tendency to retain fluid, you know, कल रात को Chinese खा ली, आज चेहरा सूज गया. Or I've had a lot of alcohol, or I've had a very salty meal and my face is swollen today, or just before my periods my face is swollen. Those kind of people should be a little more careful, especially when you're doing the under eyes. I tend to not do fillers for them in the under eye area because then it tends to get more puffy. And because there is pressure on the lymphatic fluid, the lymphatic channels, there is a blockage, and the puffiness increases. So those are the kind of people we do not inject under the eye.
And also, under the eye, though people want it to be corrected completely, we have to understand that it's not a sign of aging as such.
No.
Even in a 12-year-old, 13-year-old, you can see a little bit of hollowing.
Yes.
So it's a structural change.
Yes.
So something that occurs in younger people, don't try to chase and completely obliterate.
Yeah.
But an overfilled is completely unnatural because you don't see it.
You don't see it.
Yeah.
So now what happens is, I have seen people back in the day, even now some people, they have fillers still here. So the eyes can barely be seen. The eyes become very small,
look smaller,
And then I've had people,
older.
and I've had people who'll come and say, no, doc, but I can still see this. Fill it up here, fill it up here. It's not only dangerous, it looks unnatural. It's also dangerous.
Yeah.
So, you should know where to put your full stop, where to draw the line. And when you talk of overfilled faces and people are scared, well, that's what they've seen. We just spoke about that.
Go unnoticed.
Yeah. So if you don't overfill, and so my request to you is, go to people who are qualified, who are not just dermatologists, but trained in injectables. They can be plastic surgeons trained in injectables, or even MBBS, sometimes they are trained in injectables, and they need to know the anatomy well. They need to know the process of aging well. They need to know the physiology well. And they need to have a good artistic eye. So I don't mean to sound mean here, but look at the doctor you're going to. If the doctor you're going to looks natural and youthful and lovely like Aanchal, you're going to the right person.
Do you feel that people judge our skill by the way we look?
Of course.
Yeah.
All the time. In 26 years of my practice, I think this is one thing that I have learned. And people comment. And especially now, people are very judgmental. And they do point out that, oh, doc, you have melasma, you have pigmentation. Oh, my God, you have dark circles. And I say, well, I've accepted it. I like it. I've embraced it, And since I can't do anything about it, I might as well embrace it.
Yeah.
And on days that I want to put a concealer and go, I will. Makes me happy. I love makeup. Okay. I want my lips to look fuller. So be it. So, but they are judgmental.
And do you feel the pressure to look good all the time?
No, I don't. I don't. I sort of, I'm very like a strong-willed person. And I like to look nice as a person. I for myself. I don't do things for the sake of others, whatever I do. And you know me for that. Even when I'm on stage, even when I'm speaking, I am unbiased. And I will say things that I want to say. Sometimes it may be taken as, oh, is she arrogant or is she rude? But it's my straightforwardness. So I will do things to make myself happy. And I think everybody should do that.
That's the best way to be.
I think self-love is very important because doing stuff to your, especially in aesthetics, doing stuff to your face to make yourself look good to somebody else is never going to make you happy. You will keep coming back because there will always be one person who will point out and say, "Arey, ye acha nahi hai. Arey, ye kya ho gaya?" You know, कितनों की सुनोगे आप?
Exactly. So even when a patient comes to me, with an attendant, let's say like a guy is coming with his girlfriend or wife or partner, or a mother is getting her daughter along, I always ask them individually, do you want to get this done? Does it bother you? Only if it bothers you, get it. Because otherwise you're not going to be happy whatever the outcome.
Yeah.
So it has to
sometimes,
be to make yourself happy.
absolutely. So sometimes, in fact, when I was just telling you about, offending the patient, sometimes I actually ask the person, the accompanying person, to keep quiet because they're doing the talking.
Yeah.
So I say, calm down. I want the patient to talk. I want to listen to what he or she wants. You don't do the talking,
Yeah.
because we don't want to influence that person. In
Yeah.
our in today's day and age, especially the youngsters are constantly getting influenced either by their peers or social media and all their favorite models and influencers. And then, you have 101 beauty pageants and reality shows. And then we have, relatives and friends and family and colleagues. And then there's so much pressure constantly. I think it's our duty to make them feel like, this is not important.
Yeah.
Do it if you like it. Do it
It
if
should
you
make you
want
happy.
it.
Correct. And that's also
Just
we
forget
don't
it.
discuss this often, because not many fields have to go through this, like medical field. But in dermatology, people do judge our skills by the way we look. And also there is a little bit of pressure to look a certain way, maybe not for
Yeah.
others, but we want to look a little refreshed,
Yeah.
always
Yeah.
look the best.
Yeah.
But this is also to drive home a point that we cannot look great all the time.
No, we
There
can't. We're
will be
human
days when
beings.
we'll have puffy eyes and
Yeah.
there'll be dark circles,
Yeah.
and you can look
I
tired,
can
and
look tired.
which is okay.
Yeah.
And that's what I tell patients, that if I have access to all, like we have access to all the machines, all the injectables out there, but still we don't have perfect skin.
Yeah.
We don't have perfect features, because there's nothing like
There's
perfect.
nothing. There's
Yeah.
nothing like perfect skin, first of all. Okay, but one thing, when I talked about, when I say look at the doctor, I didn't mean for the doctor to be pressurized. I meant sometimes the doctors are overdone.
Yeah.
That is what I meant.
Yes.
You know?
Yeah, I understood
So
that. Yeah.
if the doctor is overdone, then you have to decide what you want to do. I think people get it. But yeah, I think nobody has perfect skin. There is no such thing as perfect skin. We
And
all have
because of
our
all these
flaws.
filters, it has completely altered our sense of reality, because of how we view ourselves. Because nowadays cameras come with filters, inbuilt filters. And so even when they're taking a picture, they are like, nahi, maine filter nahi use kiya hai, but it has an inbuilt filter, which is
Yeah.
making you look different.
Yeah.
So that happens quite often when I ask my patients, they'll be like, this spot has been there only from 6 months. Before that, I used to have perfect skin. So I'm like, okay, show me your pictures from 6 months back. They don't look at all like themselves when I see the picture, because it's completely with a filter. So in their head also, that is the reality that they've accepted. Why, it's impossible to look like that.
Yeah, completely. I mean, I think, just subconsciously get trained by these filters and brainwashed, and you accept that
Accept
you
that
are
as-
that version of yourself when that's not the reality.
And also one thing, ma'am, what do you say to people who feel that once the Botox will wear off and filler will wear off, they will look older?
I think that's a big myth, right? Now, when for example, if you have frown lines here and you're constantly looking angry, and so you want to relax the procedures and the corrugator muscles here, there are these muscles which are constantly working, and then you develop those lines. So, if I put in a little Botox here, I'm not making those muscles move so much for the rest of those 4 months. That means those lines are getting some rest. That means when the effect wears off, because they are well rested, they will not worsen. They will probably get back to where they are. So there's no question of, oh, ye aur kharab ho jayega. Hota hi nahi, possible hi nahi hai. That is why they now talk of preventative botulinum toxin, right? I'm not yet there, but it's a thing, So it's never going to worsen.
And also, I feel, ma'am, when we inject, let's say with Botox and filler to a 40-year-old patient or a 45-year-old, they start looking 40, 38, or let's say 35. And then as they age, after 1 or 2 years, they'll be 42. But They are used to looking 35, so that's why also they feel when it wears off they're looking older, because they've
Yeah,
forgotten their previous self.
they've
There is no
forgotten.
way to make it look worse. Like, there is no mechanism to
Yeah,
make you age faster, or make it look worse. It doesn't do that.
it doesn't do
It's
that.
just that because you're so used to seeing that kind of stretched forehead, shiny forehead, let's say, or fuller lips, which makes you look more youthful. Once that wears off, you feel you're looking older, but you're just
That
looking
doesn't
how
happen.
you were before.
Also, hyaluronic acid per se is a biostimulator. There is research which talks about how when you put hyaluronic acid, when you inject hyaluronic acid, it will, stimulate more collagen. And maybe it doesn't happen maybe after the age of 50, 55, but before that, if you're doing it, it is certainly building new collagen and you're only going to look
Better.
better and not worse.
Yes, that's a good segue into our second topic that I wanted to discuss, which was skin boosters, where we use hyaluronic acid. So, skin boosters, Profilo, actually works on this same principle that hyaluronic acid can stimulate
Yeah.
collagen. So, how often do you use skin booster? Who will benefit with skin boosters?
There are two types of boosters. One which is only hydrating and sort of improving the skin firmness a little bit, the Skin Vibe, the Restylane Vital. And then there is Profilo. Okay, so their concentration and cross linking of the hyaluronic acid is different. So a Profilo will hydrate a bit, but it will firm the skin more and it will stimulate your collagen and tighten your skin over a period of time. So you do 2 sessions, 1 month apart, and then you leave it for about a year or 9 months or whatever. And it helps to hydrate, it helps to firm. The other ones, the hydrating boosters like the Skin Vive or the Vital, or these are like tiny shots of hyaluronic acid. They are literally like injecting a moisturizer into
Under
the
the skin,
skin,
yes.
right? And they will, um, absorb water and plump the skin and hydrate the skin. And we all know that hyaluronic acid has this amazing ability. It's a humectant, absorbs water, and it keeps about 1,000 times its weight of water there. So then obviously the skin shines because it's well hydrated from within. Light falls, reflects, beautiful. And you have that, that softness, dewy skin, right? So that's what these skin boosters do. And to a certain extent, they will also slow down or put a little bit of a brake to the process of aging. Um, I have also seen that people with dilated pores and very superficial scars improve with these skin boosters. I will not say the deep scars go, but just superficial scars, definitely. And usually I like to do them, once in 3 months if they are the hydrating ones. So do one, repeat it after 3 months. But there are newer ones where we're repeating after 9 months. So you do a session and then you repeat it after 9 months. And the Profilo I usually do twice a year. So 2 sessions back to back, a month apart. And that's it. And then come back after a year. Um, I have honestly not seen any side effects. There may be bruising, there may be a little bit of swelling, very temporary. And I have to tell our viewers here that bruising, when we do any kind of injection, whether it's botulinum toxin or it's fillers or it's boosters, is a very normal reaction. It is
not a side
not a
effect.
side effect, right? The face is full of blood vessels. It has capillaries, it has veins, it has arteries, it has arterioles. You'll be amazed if you look under the microscope or you just take a scan and see it's like fully like a network. And obviously, if you put a needle and there's going to be a little bleeding, and that bleeding, imagine a bucket of water or this cup of tea falling here that, sort of spreads on. And that color is going to remain for a while till you wipe it off. So that's the bruise. But the body has this amazing tendency to wipe it off on its own because all those particles of broken blood, hemoglobin into hemosiderin, and it goes off. The body will just take it off in about a week or 10 days. So it is not a side effect. Now, that's something I want to say. So now, coming back to boosters, who do I do it to? Anyone who's above 35, I love to do, Profilo. And Anyone who is above 35 and has very dry skin, I would love to do the other boosters also, the Skin Vive or the Vital, because they need more hydration. As it is, as we age, with a dip in estrogen and post menopause, the skin gets very dry. So you can actually do a combination of both. You can do Profilo and then give it a little bit of break, maybe 6 months, 8 months, and do a Vital or a Skin Vive. But in younger people, in brides, in people below 35, but maybe above 25, or there's no cut off age as such. If you have dry, dehydrated
You
skin,
can get skin booster.
you can get a skin booster done. And I love to do it for brides and grooms because the skin really glows. And I say just do it about 2 months before or a month and a half before. And it's okay not to repeat it, but
It gives good
you
results,
only
yeah.
get married once maybe. And so you could do it. So that's how I do it in younger people. If they have dry, dehydrated skin, there's no age factor. Of course, I won't do it in an 18 or a 20-year-old. I would still wait for a 25 or a 26. But my usual is, I think, above 30.
So on this topic of injectables, there are two new kids in the block that are like new entrants, Exosomes and PDRN. So I just want to touch upon exosomes. Where do you think it has its place? What kind of patient do you do exosomes in? What is your preferred method? Is it microneedling or injecting? And PDRN.
So exosomes, the big buzzword now, right? What are they? They are these vesicles which carry a lot of messengers to the cells. There are various cells in the body, right? Some cells will form pigment, some will form collagen, some will form bone, whatever. So now exosomes have all these lipids and proteins and DNA and whatever, and then you inject them or you use a microneedling device and you pour them, and then they go to those cells and they stimulate those cells, and that's how they can reduce hyperpigmentation, they can reduce fine lines, they're said to be amazing for anti-aging. You have plant exosomes and you have umbilical cord exosomes. Now, it's, I think, a very nascent stage, at a very, very nascent, at a very primitive stage right now, because we still need adequate amount of study and research and data to validate the safety of an exosome, especially if it is from human umbilical cord.
And especially when it's injected.
When it's injected.
It's not FDA approved for injection.
It's not FDA approved for injections at all. So, yes, it's bright. The future is bright with exosomes, but you've got to wait and see. And also the way they process it and whose umbilical cord are they obtaining it from? Is it a pathological or a normal umbilical cord? All that has to be taken into account. So a lot of those regulations have to be in place, and we need that research, and we need to figure whether when you're injecting it, is it going to mutate or is it going to be normal?
Yeah.
Right? So there are all those question marks, and so I would not inject exosomes. I would probably use a microneedling device and just allow it to seep into the upper layers of the skin to probably give you that glow or help in removing the pigmentation which is on the surface, upper layers, and not go beyond that till I have data. If there's evidence-based data, then I'm happy to do it, because we are dealing with human beings here. We're not dealing with toys, Coming to PDRN,
which is also known as salmon sperm DNA or salmon sperm facial, they call it.
Yes. So polydeoxyribonucleic acid and polynucleotides, there are two types. And they're supposed to be DNA which match the skin of a human. Salmons and trouts, basically taken from their sperms, and it's DNA from their sperms in a bottle. Now, again, they say that they're not killing the fish. They're only taking the sperms but we don't know. We've not gone and seen that. Again, in a very primitive stage. So you can use it with a microneedling device, still not FDA approved. Use it with a microneedling device or super diluted, or use a plant-based PDRN. That you do get plant-based PDRNs now. And I have to tell you though that I am seeing decent amount of improvement in under eye darkening.
Yes.
Something which a lot of creams don't do. When it comes to lasers, you have to be very, very careful. And still, you have the Pico laser, you have the Q switch laser. They do help to a certain extent, but this is something, it's a revolution.
Yes, ma'am. I totally agree. PDRN for the under eye, I feel, is going to be a game changer in years to come, as like you said,
As it evolves,
as
and
it
as it is
evolves.
backed with
Yes,
science.
because it helps in improving the quality of skin in the under eye area, which we cannot do with other modalities as much. Because with skin tightening devices, we don't want to, reduce the amount of fat in the under eye area. We don't want to go too deep. With botulinum toxin, we know we can't inject too much because that can then
Work on the muscles and weaken the muscle.
Weaken the
there.
muscles. Also, the tear film can be a problem. So that's why I feel PDRN, if one area that it totally hits the target is in the under eye.
Oh, completely.
It really helps in improving the under eye, the quality of the skin in the under eye area. So you can't put a finger as to what it's improving. It's just improving everything from the darkness to the fine lines and wrinkles to the just the quality, overall quality of the skin.
It's not filling though.
No, it's not filling.
It's
at
not
all.
filling. So people who ask, they often ask and they say, is it a replacement to a filler? And I'd say, no, it is not. But yes, if you don't have to fill all the time. You can do things like PRP and all of these other treatments, and help your under eyes if they're making you look very tired.
And ma'am, now I want to go into another part, which is IV, intravenous glutathione as a part of anti-aging. Are you somebody who does it? What do you feel about IV glutathione?
I do IV glutathione. But number one, I don't buy it from random websites and random places. There is glutathione which comes in a box and it says 5,000 milligrams and 10,000 milligrams. And then it has another vial of alpha lipoic acid and another vial of collagen and something else and something else. A lot of Korean ones and a lot of Swiss. I don't know if they're really Swiss, but the label says Swiss. And it's very alarming because you really don't know what is there in it and what you're putting inside your body. Now, glutathione is given for liver issues, right? My husband's a gastrointestinal surgeon, and whenever he treats a liver disorder, there are times when he gives a 600 milligram or a 1200 milligram IV glutathione. And it's not just him, it's the fraternity. It's FDA approved for liver disorders. So, which means if you are procuring a medical grade glutathione, which is properly FDA approved and safe, and you're not crossing the line and doing 5,000 milligrams per session, and you're calling the patient every week for 5,000, 10,000 and going insane, I think it's a very good antioxidant. And having said that, I have taken glutathione myself, not to become fair, but just because I've had 101 allergies. I couldn't sit if there was a plant near me. I would start sneezing. And now all those allergies seem to have disappeared. And that's just because I took glutathione once every 2 to 3 months. And I did it for about a year. Now I don't. I do it still if I have to travel because I know I still have, asthma and I do have allergies, and some allergies are still persistent. Some have gone. And so it helps me because then it sort of, is an antioxidant. It is a free radical scavenger. It is improving my immunity somewhere, although we still have to wait for evidence-based data.
Especially on how often to give it, what is the frequency.
What's the frequency.
And how long we can continue it.
Yeah. I got trolled by a very popular so-called liver specialist. With due respect to him, I only spoke about my experience of glutathione. And literature says that it's a good antioxidant. And everybody's doing it. Now, even dermatologists are doing it. You have IV clinics, you have everything. Please make sure that it's not some random glutathione. Do not overdose. Do not do weekly doses. Keep all of that in mind. And do not aim at becoming fair.
Yeah. It's not going to happen.
It's not going to happen. And even if it does, by a freak chance, you get a side effect of glutathione and your melanin starts reducing and you start looking fairer. When you stop it, you're back to square one,
Yeah, it's not going to last.
right? So that's my view on glutathione.
Now, what is your view on supplements like vitamin D, vitamin K2 has all this, rage right now, especially when it comes to bone health and as an anti-aging supplement. What do you feel about this?
See, D has always been helpful, right? D is also a hormone. Gets changes in the body and becomes a hormone. We've seen that D helps with psoriasis, with acne.
Yes.
If you have PCOS and you're deficient, a lot of eczemas. So it's tested, and also hair fall, right? But it's not going to make you glow. I don't think it's going to take off pigmentation or make you glow. It's definitely going to help you with these kind of disorders if you have any of these skin disorders. When it comes to K2, the formulations are very unstable ingredient. Not stable when exposed to light, photosensitive, and so they're still making those formulations. The moment you put it into a cream, it becomes unstable. The moment it's exposed to light, it becomes unstable. So they're trying to make formulations and crack that bit, and from MK4, they're trying to break it to MK10 and those kind of things. Help K2 helps because it's an anti-inflammatory and antioxidant. It also helps in, if there's engorged blood vessels, it helps in releasing that. So, but we don't know if it's going to help when you put it in a cream.
What about
And
oral vitamin
how much
K2?
of it is going to help it in a cream? So, Achal, I'm a big believer of not taking supplements if you don't require it.
Yeah, absolutely. Same.
So if your body doesn't need a B12 or a D3 or
Don't
a B
take
complex, if you think your levels are normal, then there's nothing called prevention and you're taking 10 tablets. If your health, your diet is, a wholesome diet, a well-balanced diet, and sufficient enough to give you all the proteins and the trace elements and the vitamins and, and the minerals, I don't see why you should be taking so many
Supplements.
preventative supplements.
And also because the supplement industry is not as tightly regulated as the pharmaceutical industry.
completely.
There is no approval, there is no testing as to how do they contain the exact amount that has been written on the labeling, how has the testing been done, what is their shelf life, nothing at all. Nobody's
Nothing at
testing it. It's just out there. It's considered as a food, so
Yeah.
it comes under that category. So I feel that if you don't require a supplement, don't take it. It's
Yeah.
not necessary.
Yeah.
Coming-
I think when you have issues like, you have hair fall and you need not just biotin, but all the A, B,
Yeah,
C, D,
no, that's different, of
then
course.
you need it. If you, wherever there's a need, you take it.
Not on a regular basis. What are your thoughts on collagen powders?
Oh my God. So, I was a big non-believer of collagen powders, a complete non-believer, because sort of it doesn't really get absorbed. The creams anyway don't get absorbed, but breaks down, doesn't get absorbed, efficacy is less, lack of evidence, lack of literature. But now if you read PubMed, which is our, go-to site for all the medical data, evidence-based data, I am seeing more and more papers which talk about collagen, at least improving a little bit of skin elasticity. I will take it with a pinch of salt still.
That's all, ma'am, because when you look at these studies, like they are seeing these changes at such a
minuscule
level. I feel that much of improvement in hydration or moisturization or water content can be just with applying a moisturizer, maybe.
Yeah.
So can you completely attribute it to just collagen powder? Even if you can, if it is in such a small kind of such a subtle change, taking something so expensive every single day.
Yeah.
Does it actually make sense?
I'm not a believer of it at all. But having said that, if somebody asks me, should I take collagen powder?
Yeah.
I don't, sort of dissuade them or discourage them and say, don't take it. I would say to each his own. You want to take it, please take
At
it.
least it's not harmful.
It's not harmful, So that's my take on it. I did use a collagen powder myself for almost a year, because I know that these things will not work over 3 months and 4 months. I maybe saw a 10% improvement in my hair texture, but that's all that I saw, nothing else.
For that, we can just take a high protein diet, or
Yeah.
a good protein
Amino
would
acids,
probably
high
be
protein diet, and maybe some good, for texture, if you're using some good hair strengthening mask, that could probably do the trick. But yeah, and it was marine collagen, so I don't know yet.
तो हमने बहुत सारे मशीन्स की, लेज़र्स की, इंजेक्टेबल्स के बारे में बात किया एंड देयर इम्पैक्ट ऑन एजिंग, लेकिन सबसे ज़्यादा इंपॉर्टेंट तो लाइफस्टाइल है. एज लॉन्ग एज यू डोंट गेट दैट करेक्टेड, यू आर नॉट गोइंग टू सी रिजल्ट्स विद एवरीथिंग एल्स. लाइफस्टाइल, द थिंग्स यू पुट इनटू योर बॉडी, that is very important for you to see results, and also for you to lengthen the results जो बाकी चीज़ों से obtain किया. So I just want you to touch upon what are, if I tell you 3 things that are very very important as an anti-aging, जिसका अच्छा असर आता है बॉडी में, that जो सबको करना चाहिए.
सबसे पहले तो खाना आपका जो है वो सही होना चाहिए, है ना. तो आप जब आप खाते हो तो आपके प्लेट में नेचुरल कलर्ड जितना आप कलर भर सकते हो, ठीक है. आप ग्रीन्स ले लो, आप तो मतलब पालक ले लो, मेथी ले लो, जितने भी पत्ते हैं, आप टमाटर ले लो, ठीक है. फिर आप कुछ ऐसे फ्रूट, पपाया इस तरह का, ऑरेंज है, कैरेट्स हैं, ठीक है. तो आपको इसमें एंटीऑक्सीडेंट्स, बहुत सारे एंटीऑक्सीडेंट्स मिलते हैं. इसके साथ साथ आपको बहुत सारे विटामिन्स भी मिलते हैं. फिर आपको प्रोटीन्स ज़रूर, आपको मतलब आपके जो बाल हैं, आपका कोलाजन, हम इतनी देर कोलाजन कर रहे हैं, ये जो है ये सब कुछ आपको मिल रहा है प्रोटीन से. तो आपके डाइट में प्रोटीन जो है मिनिमम 1 ग्राम पर किलो बॉडी वेट अगर आप डेली ले लो, बहुत ही सही है. थोड़ा सा अच्छा कार्ब होना ज़रूरी है, ये नहीं कि बिल्कुल कार्ब्स बंद कर दो. थोड़ा सा गुड फैट होना चाहिए. मैं रोज़ घी खाती हूँ 1 चम्मच. तो इस तरह की चीज़ें, अगर आप एक फुल बैलेंस डाइट, और आपके डाइट में शुगर आप माइनस करो जितना हो सके. अच्छा, मुझे लोग कहते हैं कि हम तो शुगर बिल्कुल नहीं खाते हैं, हम तो ऑर्गेनिक जैगरी लेते हैं.
हाँ, जैगरी लेते हैं, कोकोनट शुगर लेते हैं,
और हम हनी डाल लेते हैं, बिल्कुल प्योर है, नेचुरल है. लेकिन मेरे दोस्त, वो जो नेचुरल चीज़ है उससे भी वो IGF-1 हार्मोन जो है वो उतना ही बढ़ जाता है, और आपको पिंपल्स आपके बढ़ सकते हैं. और जो एक प्रोसेस है ग्लाइकेशन करके, जो एजिंग का जो पैटर्न है वो ब्रेक डाउन ज़्यादा जल्दी हो जाता है, वो भी शुगर से होता है. तो चाहे आप किसी भी प्रकार का शुगर लो,
फ्रूट शुगर लो या कुछ भी लो, वो ब्रेक डाउन सेम किसी हिसाब से होने वाला है घर में.
तो वो आप बंद करो. सो ये हो गया नंबर 1 डाइट. नंबर 2 है स्ट्रेस, ठीक है. सब आजकल हर कोई जो है, हर बंदा, छोटे से छोटा और बड़े से बड़ा, हर इंसान स्ट्रेस में जीता है लाइफ. भाई क्यों? एक ही ज़िंदगी है, ठीक है. स्ट्रेस सबको आती है, लेकिन आप उसे किस तरह से उसको आप डील करते हो, स्ट्रेस को किस तरह से आप अपने आप को, मैं ये नहीं कह रही हूँ सब जेन मोड में चले जाओ, ये पॉसिबल नहीं है. लेकिन अगर वो स्ट्रेस जो है, आप जो स्ट्रेस ले रहे हो उससे आपके सोल्यूशन का हल है, तो आप ज़रूर बाकायदा स्ट्रेस ले लो. बट ऐसा नहीं होता है. स्ट्रेस से आपका स्किन और आपके बाल पूरे डैमेज हो जाते हैं, और एजिंग जो है वो बहुत रैपिडली हो जाता है. तो या आप स्ट्रेस को मतलब मेंटेन करने के लिए, टू कोप विद इट, आप कोई हॉबी, आप सिंगिंग, डांसिंग, पेंटिंग, लिसनिंग टू म्यूज़िक, कुछ एक ऐसा दिन में 1 घंटे के लिए एक अपना मी टाइम जो हम कहते हैं, वो स्ट्रेस को
रिड्यूसिंग स्क्रोलिंग टाइम. आई थिंक स्क्रीन टाइम रिड्यूस करना बहुत ज़्यादा ज़रूरी हो गया है. आजकल हम इतना स्क्रोल करते हैं, इतना माइंडलेस स्क्रोलिंग, उसका भी कितना नेगेटिव इम्पैक्ट है on your mental health, in your whole well-being,
in your sleep.
Yeah, on your
आप
sleep.
अगर अक्सर लोग जो हैं रात को सोने से पहले 1-2 घंटे, अब कैसे टाइम बीत गया पता नहीं. आपको सोना था 10:30 बजे और टाइम आप देख रहे हो 1 बज रहे. आपने किया क्या इतनी देर? आप सिर्फ स्क्रोल कर रहे हो. I have seen it in my house. And so बहुत ज़रूरी है कि अगर आप उसमें फिर वही बात हो जाती है ना कि आपको नींद तो अच्छी होनी चाहिए ना। जब आप सोते हो तब आपके सारे अच्छे हार्मोन्स जो है वो जाग जाते हैं और वो रिपेयर करते हैं स्किन को, बॉडी को, ठीक है। और आपका जो कॉर्टिसोल है जो खराब जो बहुत तरीके से अच्छा, मतलब कुछ फ़ायदे भी हैं उसके, बट मोस्टली इट्स अ बैड हार्मोन, वो कम हो जाता है जब आप सोते हो। तो स्किन को उतनी ज़रूरत होती है नींद की और बॉडी को भी ज़रूरत होती है। तो वो हो गया कि आपने बहुत स्क्रॉल जितना किया उतना फिर आपका स्लीप टाइम भी कम हो गया और आप सोते भी सही ढंग से नहीं हो। आपका जो लाइट स्लीप वो ज़्यादा हो जाता है, डीप स्लीप कम हो जाता है, REM स्लीप कम हो जाता है। इट्स वेरी इंपॉर्टेंट। तो ये आपका जो है स्ट्रेस एंड स्लीप गो हैंड इन हैंड, ये आपका सेकेंड हो गया। थर्ड मैं कहूँगी, जितने बैड हैबिट्स हैं ना, whether it's smoking, vape, Juul, alcohol, all of these may be very chic, may be a fad, तो उनको फैड तक रहने दो, मतलब उसे आदत मत बना दो। कभी एक आध कभी पार्टी हो गई, बट वो पार्टी हर रोज नहीं होना चाहिए, है ना। तो एक लाइट जो कहते हैं, मैं तो नहीं कहती हूँ बिकॉज आई नीदर स्मोक नॉट ड्रिंक, आई विल नॉट सपोर्ट इट ऑल्सो, बट जो भी इस तरह की आदतें जितना हो सके उन्हें आप निकाल दो अपनी ज़िंदगी से, अगर आपको स्वस्थ रहना हो और आपकी स्किन को और आपके बालों को भी स्वस्थ रखना हो और यंग यूथफुल रखना हो, तो ये बहुत ज़रूरी है।
करेक्ट। एंड मैम इफ़ आई आस्क यू कि 3 ऐसे स्किन केयर प्रोडक्ट्स आप बताइए, नॉट ब्रांड नेम्स, इंग्रेडिएंट्स और प्रोडक्ट्स दैट यू प्रेफर, जो आपके टॉप 3 है फॉर एंटी एजिंग।
सबसे पहले तो सनस्क्रीन है ना, वो तो बिल्कुल नॉन नेगोशिएबल है। आपको मतलब मुझे कल किसी ने कहा कि अरे सनस्क्रीन से कैंसर होता है, मैंने कहा भाई साहब खाना खाना बंद कर दो, सनस्क्रीन मत बंद करना बिकॉज इफ़ यू वांट गुड स्किन, आपको नहीं चाहिए गुड स्किन तो कोई बात नहीं, उल्टा सनस्क्रीन से कैंसर से बचते हो आप, है ना। स्किन कैंसर, स्क्वामस सेल कार्सिनोमा, मेलानोमा बहुत डेंजरस हो सकता है। तो आई विल से सनस्क्रीन फॉर एंटी एजिंग। देन आई लव रेटिनॉइड्स, मुझे बहुत पसंद है। मेरा स्किन जो है बहुत सेंसिटिव है और मेरा स्किन सेंसिटिव है, बट मैं रेटिनॉइड रेगुलरली यूज़ करती हूँ। लोगों को लगता है रेटिनॉल और रेटिनॉइड से स्किन ज़्यादा सेंसिटिव हो जाता
बिल्कुल
है,
नहीं।
ये बिल्कुल गलत फहमी है। तो ये मेरा नंबर 2 जो है एंटी एजिंग इंग्रेडिएंट है। एंड देन मॉइस्चराइज़र, सो चूँकि मेरा स्किन बहुत ज़्यादा ड्राई है, मुझे सेरामाइड्स की ज़रूरत पड़ती है, हाइलुरोनिक एसिड की नहीं, ठीक है।
एक्चुअली मॉइस्चराइजर बहुत इंपॉर्टेंट है, बट वी डोंट स्ट्रेस ऑन इट इनफ। हम इतना ज़्यादा सीरम्स, एक्टिव्स के ऊपर इतना फोकस कर रहे हैं कि हम बेसिक्स को भूल गए। बेसिक ऑफ जस्ट मॉइस्चराइजर एंड सनस्क्रीन जो स्किन को रिपेयर करती है और जो धूप से बचाती है, दैट इज़ द मोस्ट इंपॉर्टेंट थिंग टू डू। तो उसके ऊपर वो बेस बना के फिर आप कुछ और ऐड कर सकते हो, लेकिन ऐसा नहीं कि सिर्फ आप एक्टिव्स ही लगा रहे हो लेकिन बेसिक्स भूल गए, फिर आपको एक्टिव्स का
काम ही नहीं होगा
और मुझे लगता है वो और ख़राब कर सकता है स्किन को,
बिल्कुल
और बैरियर को डैमेज कर सकता है।
इनफैक्ट you're right, वो इनफैक्ट और बैरियर को डैमेज कर सकता है। अगर आप 3 इंग्रेडिएंट्स सनस्क्रीन मॉइस्चराइजर को हटा करके 3 एंटी एजिंग
इंग्रेडिएंट्स,
तो टॉप मेरे लिए रेटिनॉइड है, फिर मेरे लिए पेप्टाइड्स हैं, और फिर कहीं मेरे लिए विटामिन सी आ जाएगा, वो उस ऑर्डर में आ जाता है। या
माइन वुड आल्सो बी द सेम, रेटिनॉल, पेप्टाइड्स एंड विटामिन सी। यस।
क्या ऐसी कौन सी 3 चीज़ें जो आप नहीं करोगे एंटी एजिंग के लिए?
प्रोडक्ट्स टू यूज।
I don't, not products you, 3 things that you will not about lifestyle, but generally, like too many products or
3 things I wouldn't do is I would never copy somebody else's skincare routine.
Bang.
That is so rampant in today's, because of social media, that everybody just wants to copy somebody else's skincare routine. I would not do that. Second, I would not use too many skincare products. I feel that's counterproductive. जितना आप products यूज़ कर रहे हो, आप बस उसको डाइल्यूट कर रहे हो। मेंटल थोड़ी ना है वो, एकदम एक आर्मर नहीं है कि एक लेयर लगा लिया और वो पूरा एब्जॉर्ब हो जाएगा, आप नेक्स्ट लेयर लगाओगे वो भी उतना ही एब्जॉर्ब होगा। नहीं, वो सिर्फ एक जगह से दूसरी जगह पे आप शिफ्ट कर रहे हो, एंड यू जस्ट डाइल्यूटिंग एट द एंड ऑफ द डे. सो नॉट यूजिंग टू मेनी प्रोडक्ट्स, दैट्स फॉर श्योर. एंड थर्ड, I would never skip a moisturizer no matter what your skin type. That is important, बिकॉज पीपल विद ऑयली स्किन उनको लगता है कि नहीं, जब भी मैं मॉइस्चराइजर लगा दूँ मेरा पिंपल ज़्यादा बढ़ जाते हैं, या ऑयली शाइनी स्किन मुझे अच्छा नहीं लगता. नहीं, देयर इज़ अ मॉइस्चराइजर फॉर एवरी स्किन टाइप, फॉर एवरी स्किन कंसर्न. You have to use a moisturizer no matter what.
100% true. Yeah.
Ma'am, now with all this social media and so much of content on Instagram, everybody is looking younger than their age. Like you must have seen that trend where they blow a candle, a birthday cake candle, and then it's written 30, and then they're like, no, they blow it out, and then they put 4, and they're 40. Every 40-year-old is looking like 20. I wanted to ask you, how often does it happen in your OPD that a patient walks in and you are kind of surprised looking at their age, that, oh, this person looks much younger than the age written on the file? How often does that happen?
These days, a lot more. As I told you, I started practice in the year 2000. So I don't think back in the day that happened. Maybe in the last decade, and especially in the last maybe 5 or 6 years, I see it happening a lot more, where I feel I'm sort of misjudging the age of that person. I think it's a nice trend because people are taking care of themselves. They are trying to look like healthier and younger, and more, their energy levels are higher. It's not just about doing things for their skin. I think overall, people are into fitness, people are into eating right, people are into yoga and meditation and all of that overall. Plus, of course, it's skincare and us.
And also, I feel like you said, ma'am, the energy is different, and we look at age differently now.
Yeah.
I'm going to be 40 this year, and when my mother turned 40, I remember feeling that she's kind of old. Yeah, she's old.
Yeah. Oh my God.
Not only that, we used to feel old, she herself used to feel that now I'm
Yeah.
40.
Yeah.
Now back pain or this has started, and we accepted that. But now it's not the norm. Like, I'm 40 and I don't feel 40 at all. And now the way we view aging, the whole process of aging has completely changed. We want to be active for longer, lifting weights, doing cardio exercises, like you said, yoga, all that has definitely had a positive impact on our well-being. We want to live longer, but we want to improve the quality of life.
Yeah. Quality of life is what I think people have now slowly understood, and they're trying to focus on that. Sometimes it becomes a little detrimental because then work-life balance ke chakkar mein work goes for a toss, especially with, but I think it's a good positive change. To feel good, to look good, to be energetic, to not have too many disorders and diseases. If it's possible, if it's in your hands, if it's within your limits. A lot of times it may not be, but it's a very good space that we're in. And you rightly said, I am 50 plus, but I don't feel like. I can sit with a teenager and have a very nice conversation, like a teenager conversation with the teenager. Or I can sit with a 60-year-old and have a similar conversation with a 60-year-old, because it's no longer about age.
Yeah.
And it's for all of us, I think. It's no longer about age. It's, I think age is definitely, most certainly, just a number now.
Because of our varied interests, and also we keep ourselves updated and we look forward to things in life. There are so many things to do now as dermatologists also. That is not the only defining feature, Like you said, you sing, you're interested in music. So we all have other facets. I think that is very important to keep us young. Yeah. So whenever I tell people that, it's not just about the skincare that you're using, it's also about the forward that you have, the passion you have to live, have hobbies. It's the energy that people look at and they feel that, they look older or younger. Whenever we feel that somebody looks younger, it's usually because they're so energetic, they're full of life, they're looking forward to some things, they have goals, they have something to achieve. I think that really adds to the personality and to the way you look.
Yeah,
for sure.
Yeah. Positivity at the end of it all, wherever you are and within yourself also. And not always sort of thinking of all the negatives or what you haven't achieved in life, but having gratitude for what you have achieved and what you have, and then looking forward to every day with a lot of positivity.
That's very important. Ma'am, I wanted to ask, do celebrities age better?
I think they're so disciplined in their lifestyle, which is why they age better. Back in the day, older, celebrities of the 50s and stuff, I don't think they took good care of themselves. And so you saw them aging rapidly. But later on, they are very, very disciplined, whether it's their exercise or their diet or, everything that they do. Um, of course, they have very erratic schedules and it's very tough. It's really tough to face the camera and repeat that one line 200 times. The shots go on sometimes 20 shots, 30 shots for like a 1 minute video. So, very, very stressful. That stress to look good in front of the camera all the time, but very disciplined. And if you tell them you have to use these creams, they will do it. If you tell them you have to do whatever treatments to maintain, they will do it because that's the kind of discipline, that they live. And that's why they age better. We tend to slack a little sometimes. अरे चलो, अभी इस holiday में ना हम ये कर लेते हैं. अब ये, how many times on a holiday have you religiously gone into the, gone and done your weight training and your gym? We think नहीं हम तो चल ही लेते हैं, we walk. So that kind of discipline.
So it's not just genetics and not just skincare products. It's also a very strict lifestyle.
It's a very
diet.
Strict lifestyle.
Also, they have a nutritionist to take care of their diet. And, there are a lot of people working to make them look that way.
Yeah.
And
very true. Very true.
So
and
that
these days also, thanks to some of the celebrities, people are more open to consulting with mental health,
yes.
The therapists and people who will help you out with mental health. And that's a big, big, positive jump for our own health and well-being, And automatically, if we come back to where we started, where we said stress makes you age faster. So having a well-balanced, mental health is also equally important.
Yes. So now I'm just going to ask a few questions. What do you think about at-home microcurrent devices?
I don't think anything about them. I don't know if they're doing that kind of muscle stimulation that they're supposed to do. From my patients who use it, they're very happy. But it's just for that one party that you want to go to. So you do a little bit, you look nice for the party, for those 4 hours, and that's it.
And face yoga. What are your thoughts on face yoga?
So I have a friend who does face yoga. And I was having this argument with her that when you exercise your muscles, your lines will become, more prominent. And she was like, yeah, you're right. Because when you're exercising this more, you're getting frown lines, you're smiling more, you're getting crow's feet. When you're clenching your teeth, you're getting bulky masseter muscles, your face becomes squarer. But she said a different thing. She said when your movements that you do, not the exercises or those kind of movements, but the movements that you would do with your hands probably help in some way. Now, I'm not here to contradict them. But at the same time, I'm asking you to say, to not make too many those kind of movements because those will give you lines.
Also, ma'am, the face muscles and the muscles in the rest of the body is different. Like when we talk about biceps and triceps, the origin and insertion is from the bone, from one bone to the other. So it has a bulk. So when you lift weights, the bulk increases. Whereas on face, on the muscles of the face, the origin is from the bone, but it's inserting as thin fibers onto the skin.
Yeah.
So there is no tug as such, there is no tension that you're trying to create that can increase the bulk. But having said that, there is a study which has looked at face yoga and its impact on the face. And they found that 30 minutes of face yoga done about 3 times in a week can lead to slight improvement in cheek volume. Just the cheeks. Slight improvement in cheek volume.
Exactly. So how much of improvement in the cheek volume?
Subtle improvement.
But is it really doing the anti-aging that there's a question mark there. That are you going to stop the bone, the muscle, the deep fat from aging by doing face yoga or using any of those tools and devices that are being used these days, from the gua shas to the jade rollers to all of that? Those are very good for lymphatic drainage. But that's all that they will do probably.
So I was against gua sha and jade roller, but now I feel it's okay if you know how to do it, if you apply good moisturizer and then use it. The problem is, if you're too harsh with the device, we don't want too much of friction, because we know any kind of injury in our skin type can lead to darkening.
Yes.
So we don't want so much of friction being applied for no reason. But yes, gua sha people seem to like, especially people who tend to look puffy in the mornings.
Yeah,
they feel
most
that
definitely.
can,
As I said, it
that
helps
can
in
help.
lymphatic drainage. It definitely helps when you do it the right way and you have those issues of puffiness.
So
the
it will not
rollers will-
lift the face as people expect it to,
Yeah.
but no harm. You can
Yeah.
actually do it. Gua sha is okay. Okay, ma'am. So this is just, do they work or do they not? Bone broth for collagen stimulation.
Yes, better than collagen powder.
Okay.
It's giving you protein.
Resveratrol tablets.
Question mark.
IV antioxidants.
Question mark.
Microcurrent devices we did. LED face masks.
Yes, if you use a nice red LED for skin rejuvenation, it does, and if you are consistent with it, it does help. I've seen it. But also, there are random devices available in the market which are not even proper LED. The proper light emitting diode, right? It has to have a wavelength again. So the proper ones are very expensive. They're in lakhs.
But they work well.
They work well. These random ones, I don't know. Question mark there. We'll do it
Expensive
again.
anti-aging creams. Buy it or not?
No.
Expensive vitamin C serums.
No.
Peptide serum.
Okay.
Exosomes.
No.
Hyaluronic acid serum.
No.
AHA creams.
Yes and no.
Okay. Okay, ma'am. Keep or discard. Single ingredient serum.
Keep.
Facial mist.
Discard.
Face oils.
Discard.
Peel pads.
Keep.
Collagen cream.
Discard.
Powdered vitamin C.
Some are good.
You have to use it carefully.
You have
Otherwise
to
will
use it
cause
very
burns.
carefully.
Sheet masks.
One-time use.
Rice water spray.
Discard.
Rose water spray.
Discard.
Gua sha.
Keep.
Ice rollers.
Keep.
Ma'am, now we've come to the end of the podcast. 3 things that you want people to take away from this podcast.
Number one, that aging is inevitable. So no matter what you do, you will still age. So aim at looking like the best versions of yourself. Age gracefully but youthfully. That's number one. Number two, a sunscreen is non-negotiable. Very, very important. Number three, all creams, whatever it is, after a particular age, creams will not help to delay the process of aging. So you will need some amount of treatments, some amount of push to, sort of prevent that building from collapsing.
Thank you so much, ma'am. This was amazing. We covered all the aspects of anti-aging. I'm sure people will get to learn a lot from this. I wanted to discuss about the treatment aspect, because there's so much of misinformation and people are not aware of what all is available that they can have access to, and we put so much of importance on just creams and just topical treatment. So with this podcast, I hope now people understand what creams can achieve and how the other devices can assist in getting the skin that they want and to slow the process of aging. Thank you so much, ma'am.
Thank you so much for having me, Aanchal. It's been such a pleasure. And I wish you all the best, not just for your podcasts. Please, guys, watch her podcasts. They're going to be amazing. Decoding Health. Yes. So, Decoding Health with Dr. Aanchal. That's what you should watch. If you have any podcast on your list, that should be the number one.
Thank you so much, ma'am.
Thank you.
So this is a detailed podcast on anti-aging treatments. I'm sure you found it useful. If you liked such skin and hair related content, you can follow me on my Instagram handle, Dr. Aanchal MD, where I post such skin and hair related content daily. Thank you for watching.